Hi everyone, and welcome to the GuideWell Insights Lounge. My name is Kate Warnock, and we're coming to you live from the Oliver Wyman Health Innovation Summit. We're here with one of the leaders of the Health Innovation Summit, Terry Stone. Terry, welcome to the interview.
Thank you, Kate. It's always fun.
Well, Terry, you're going to be kicking off this two-day wonderful event where you're convening health industry thought leaders really to talk through all of the impacts around the consumer imperative and how healthcare is transforming from the outside in. So, wonderful event, fantastic themes, and including yourself, speakers that just can't be matched. So, excited to have this, and we'll be streaming live for the next 2 days. So, excited to have you join us.
Well, thank you. We're excited once again to have you sponsoring this great effort.
So, Terry, your position with Oliver Wyman, you're the global managing partner for the Health and Life Sciences practice. Big position, and again, you're starting with opening this summit, talking about the consumer, obviously, and we've been talking about the consumer in the health industry for a long time, yet we still seem to lag behind other industries. Why is that? And what can we do to fix it?
You know, that's a great question. I think in the last 3 years, in some way, shape, or form, we've touched on this each year about where are we and why are we kind of stuck. So that actually is a key part of why we focus the conference on what we have this year, because healthcare does seem to be a little bit stuck. And I think it's a great question. We've given a lot of thought to it. And I'll start by the first most basic premise being healthcare has always been it's a B2B industry. It always has been, right? Versus a real business to consumer industry. So in B2B businesses, I mean, really health plans we're selling to largely employers, right? Quite frankly, provider systems we're negotiating with health plans, and quite frankly, the consumer in some ways was an afterthought, okay? But that sounds a little overly simplistic, like, okay, so it's B2B, now we have to be B2C, but I think it's really important that people understand what happens when you're in a B2B market versus a B2C, and why does it make it so difficult to change? So first of all, in a business-to-business market, your buyer's often buying on a lot more like rational, logical reasons. You also have very sophisticated buyers buying a complicated service. And in some ways, unintentionally, I would argue, the product gets more complicated as each side tries to prove to one another that they're adding more value, right? It's almost the antithesis of what you need for the consumer. Right. And that's just a really hard paradigm to break. And that actually is pervasive through most of healthcare. I'd argue the drug industry is probably the closest to having found its way once it had access to direct-to-consumer advertising, which gets a lot of backlash for a lot of reasons. But they're one of the first parts of healthcare that's really started to have to embrace what it is about the consumer and what they need, and how do I meet them where they are.
Terrific. All right, let's go into our next question then. How important is it for organizations to really understand the full ecosystem and be able to connect the dots? Another theme here at the summit.
Sure. We talk a lot about the ecosystem in healthcare. I mean, it's funny, we talk about the healthcare system in the US. And I think someone said it great once where they commented that we don't have a system. What we have is a bunch of parts and pieces that are all stuck together, and you get this sort of random ecosystem, if you will. And I think it's really, really important that players in the space understand where they sit in the ecosystem and how the consumer views it, and how the consumer thinks about interacting with the parts and pieces, and how you stitch it together in order to add value to the consumer and simplify their life, while also making sure you carve out a spot for yourself that's sustainable where you can make money, because many of these are, commercial enterprises. Sure. And I'll give you a slight example of something in an analogous industry that I think is important in comparing to healthcare. And I'd argue it's never good when you're compared with a downward comparison to the airline industry. But I want to explain why it's important to connect the ecosystem, right? Like, in the rest of our lives, we expect as consumers that when we're going to get a good or service, the pieces work together. Okay? Imagine if American Airlines didn't want to share its data so you couldn't find out on Expedia what was available. Imagine if, American Airlines doesn't control air traffic control. That's controlled by the government or the airport. Imagine if they just said, well, we're not alerting you to a delay if it happens to be caused by weather or something which we don't control, because that's not our job. Right? Imagine if they asked you, the consumer, to choose, do you want Pilot John or Pilot Susie? These are their credentials, et cetera. And that's exactly what we do in healthcare. Right. So we've taken the complexity of the system that is essentially grown from the ground up, and we have kind of foisted it upon the consumer. And then now we're scrambling to try and unravel it. But it's almost backwards, and that's why you have to start with a blank sheet of paper.
Okay, well, let's start with that blank sheet of paper then. Who do you think is most in the best position to really disrupt the health market?
Right. And again, it's sort of the, I don't know, $10 billion question. I think if I knew specifically who, I probably wouldn't be sitting here and I'd be betting my money on someone else. But I will speak kind of categorically that in my role, I see lots of players in healthcare. I cut across payers, providers, life science companies, health services, and tech innovators. And what I have kind of strongly come to believe is that most likely the disruption that really changes things is going to come from the outside. So healthcare is in some capacity going to be Airbnb'd or Uberized. And by that I don't mean Uber for health. I mean somebody out of left field takes an industry that's kind of not delighting the stakeholders and has excess waste in it and is going to kind of disrupt and shake it out. And that could be in the form of now the Apples or the Googles of the world, right? It could be the Walmarts of the world, you know? The average Walmart consumer, I believe, goes in more than twice a week, over 100 times a year. How did they start, if you start getting traction with people who have that frequent a touch with you, there's a lot you wind up doing. And I think when I advise my clients, I say you should be watching for the people on the fringe, not your competitor down the street.
Right. Well, all right, so our final question for you, Terry. Tee up for us the next couple days as far as the speakers, maybe the people that you're most excited to see.
Sure. Well, okay, I've had a hand in a lot of it with the team, so I'm actually excited about all of it. But that being said, I think what others should expect to see and what I am excited about overall is the idea that I think we're kind of tipping into a new era of what's going on in healthcare. And we kind of dragged healthcare players a little bit kicking and screaming into this next generation world. The government kind of foisted and regulated it upon us. It kind of pulled people in and they realized they had to adapt. Then all of a sudden, you know, Silicon Valley and others started pouring money into healthcare and innovators were springing up left and right. And I think we're now getting into the era in healthcare where it's about business model disruption and reinvention. We're having massive amounts of consolidation. You got everybody and their brother often pulling out of ACA, right? Creating a lot of structural challenges. And even the startups, I think the investment in the startup category started to plateau, and you're gonna see a lot more consolidation of what's going on. So what we're hoping to achieve this year is going beyond the basic part of innovation, which is, oh, what's that company do? Or what's that technology? Or that seems really neat. And actually what we've been striving to do for the last couple of years is get underneath what's the magic in what makes that company special? What is it that makes it stick? Why are consumers delighted? And how do we get beyond the basics of the functions and the features and figure out what it is that really makes it sing and really makes it kind of win? And I think that's a lot of what we'll be sharing. So we'll be talking not only about innovator companies, but about culture, about mindset, about how do you drive behavioral change in consumers. So it's just going to cut all across the board, and we're really excited about how we think it will help our clients, help other stakeholders in the healthcare industry actually have more impact and delight their customers.
Well, Terry Stone, I mean, it's always a pleasure for GuideWell to be part of this magnificent event, and I want to thank you for your time. I know you've got a very full day ahead of you, but appreciate that you spent some time with us here in the GuideWell Insights Lounge. So, best of luck.
Thank
Keep
you.
your energy
We're
up for the
excited.
next couple days. We know that you will. And my name is Kate Warnock. Thanks so much for watching. Good morning, everyone, and welcome back to the GuideWell Insights Lounge. We're here at the Oliver Wyman Health Innovation Summit. My name is Kate Warnock, and I have one of our very favorite guests joining us right now, Renee Finley. Renee, welcome to the interview.
Thank you, Kate. Glad to be here.
We're happy to have you. Renee is the Vice President of Innovation at GuideWell. So Renee, here we are at the summit, and the overarching theme has been the consumer imperative. In your role, I was wondering, what is GuideWell's strategic approach to innovation, and how has consumerism evolved that strategy since you've been in your role?
Absolutely. Thank you so much. So at GuideWell, our focus on innovation really begins with a laser sharp focus on the critical issues that need to be solved. So instead of trying to just focus on the latest, greatest technologies, we're really trying to understand and hone in on those critical problems. And in doing that, we put the patient or the consumer really at the center. And we anchor it around 7 core centers of excellence, if you will, that allow the consumer to be empowered. And those centers of excellence include everything from how we think about the whole being, right, the mind, body, and spirit of the individual. We think about the tools and resources, the digital technologies, the remote healthcare solutions that will help to give them ubiquitous access to healthcare. We think about the what we call consumer engagement pieces, which are the opportunities for us to connect with them through social, local, and mobile technologies. And then we also think about the role of data and how data can be so empowering, but it has to be actionable data and data that's relevant and in context. And so we really try to focus not just on the big data, but this hyper-personalized consumer information. So as we've made this journey, what we found is that the focus on consumerism really has to be driven around empathy, as we think about putting ourselves in the consumer's shoes. And we heard that a lot today in all of our Wyman sessions around the consumer imperative.
Absolutely. I mean, everything that you say, it just resonates so much with the speakers that we've had on. I hope that our viewers have been looking through all of our playlist. If you missed our speakers yesterday, Renee, we have them all available on demand on the GuideWell YouTube channel. But, you know, everyone from Alexandra Drain talking about empathy and Donata Tamurdo talking about how compassionate leaders like yourself are going to help the industry pivot to the consumer, which is where they always should have been, but for a host of reasons, as we know, hasn't always been the case. So wonderful that you're in your role. All right, our next question for you, Renee. As someone who actively monitors the trends in health innovation, what really has your attention as a trend worth watching?
Yeah, so there's really two or three key trends that I'm focused on right now. One is behavioral health, and it goes back to this concept of mind, body, and spirit, and how we put ourselves in the psyche of a consumer, understanding the emotions that they are feeling, and what will actually resonate with them in terms of, as Kyra talked about, you know, creating that stickiness for behavioral change. And so this whole focus on behavioral and mental health is really a key trend for us. Another one that I'm high on right now is wellness without walls. So as we've been working with Johnson & Johnson and GE and Cisco on the intelligent home, the focus there has really been on bringing solutions in an ambient way to the home setting, so that we are creating a greater continuity of care for our members and our residents. And then the third trend is really this idea around precision medicine. And I really believe that it's going to have a tremendous impact on how we think about healthcare going forward, and the enlightened view that we'll have on how to get to a personalized solution, particularly in these cases of rare and undiagnosed disease. So it'll be an area of focus for me in 2017.
Very good. Well, Renee, I was hoping let's go back to the response that you just gave us about the intelligent home.
Yes.
Where is this? And,
Sure.
you know, and tell us a little bit more about it.
Absolutely. So the Intelligent Home is located in Lake Nona Medical City, which is where our innovation center is located, just outside the Orlando airport. It's a triplex built in the Tavistock community. The idea here is that we want to be able to demonstrate products that are ready for market, but it also has products that are in test. And so we're able to capture consumer preferences, consumer likes and dislikes around the interactions with these different solutions. And then it also marries it with in the home setting, so it's not a laboratory, right? It really feels like someplace you could live. Not that you're in a test environment.
So does GuideWell have a particular area of focus for the intelligent home, or how are you supporting it?
We do, actually. So our focus, given the market in Florida, as we heard earlier in Dr. Lair's presentation around seniors, we focused on aging in place. And so we've got solutions there for monitoring movement ambiently in the home, so we're able to monitor activities for seniors. We're able to monitor through another platform called Remedy the diabetic status. And then we also have a new and emerging technology called KinderMed, and it's actually a sleep mask that emits blue light rays and will stimulate glands that prevent the secretion of melatonin. And as a result of that, we're able to prevent preterm birth. So
gosh.
it's a fascinating technology, and really excited about some of the new emerging solutions we're seeing in this space.
So I think that the thing that's wonderful about you and your role, Renee, is that it's not an academic conversation of where are we going. You are testing and continuously evaluating what makes sense for the consumer today. So even though you're looking 5 years down the road, maybe, you're really looking at how do we go plan for these applications.
That's right.
So terrific. Okay, our last question for you.
Okay.
All right, so GuideWell just took a very collaborative approach in attempting to improve the cancer patient experience through its first ever immersion event. Tell us more about this model, and what will the focus be for the next immersion?
Sure, absolutely. So we were very grateful to have the partnership of American Cancer Society, Prime Therapeutics, Lilly Council, many others, Florida Hospital, Orlando Family Physicians, as we focused on the patient experience through survivorship. And it's both the patient experience and the family experience, as it turned out, through the conversation. So through this thought leadership model, we were able to dive deep to really uncover and peel back to more clearly define those critical issues surrounding survivorship. As a result of that, we've prioritized two key themes, if you will, that now will take to concept development. Those themes are around empathy, as we talked about earlier, and end-of-life care. So both of those will be progressing, and the way that'll happen is in this digital journey through both social divergence and then coming together in a convergent model to brainstorm around these concepts and actually build those solutions going forward.
Really smart conversations to have. So when you were talking earlier, you said that one of the trends that you're watching is behavioral health.
Yes.
And so I know that that's going to be a focus for your next immersion,
That's
isn't it?
right.
Yeah.
That's right. So because, again, this concept of the consumer and their current psyche, and how do we put that at the center of what we're doing, our next immersion event will focus on behavioral health. It'll really tie into how does an individual present their best self, and it's both their best self, whether you're high performing or maybe you've been clinically diagnosed.
Okay.
We want to move away from the stigma around behavioral health issues and really peel that back in a way that allows for meaningful conversation and transparent conversation.
And I know when you were referencing earlier, Renee, that you have these centers of excellence, that you look at these trends and you look at all of these, what's impacting the health industry, that you really are going to have such an interesting, dynamic conversation around behavioral health that maybe is very unique from other conferences. So,
yes.
I look forward to you leading that. And I know that for anyone who is interested, they can go to your website, which is
That's right.
GuideWellInnovation.com, pull up the information, and there's a contact form, and we invite everyone who's watching us to really take a look. And I know that you're soliciting, you're really highly curating the
Yes.
attendees, the speakers, and the participants. So
That's right.
It's a really unique environment. And I can tell you from the cancer experience that you just hosted, the chemistry that
Yes.
came out of that group, I think is second to none. So,
Yes.
kudos to you for creating that kind of environment, for
Thank
that
you.
kind of collaboration.
Well, I think, if you create an environment where there's open transparency, it builds trust, and trust builds lasting relationships. And
For
so
sure.
we're pleased to have had that experience and look forward to the next one.
And again, it mirrors the themes that we've been talking through here at the Oliver Wyman Health Innovation Summit, how important empathy is, being real and transparent. And, as Donato Tramuto was saying, being willing to share maybe the things that have been real challenges in your own life, to bring out the best in others too.
That's right.
So,
Good.
Well, Renee, it's always a delight to have you
Thank you,
here
Kate.
at the GuideWell Insights Lounge, and I look forward to having you again at our next event. My name is Kate Warnock. Please keep watching. Hi everyone, this is Kate Warnock coming to you live from the GuideWell Insights Lounge. We're here on location at the Oliver Wyman Health Innovation Summit, and I'm so happy to bring Mr. Sam Glick to our interview. Sam, welcome.
Great to be here, Kate. Good
Sam,
to see you again.
Oh, so happy to have you. This is the second time, at least, that we have had you here at the Insights Lounge. So Sam, you have two titles with Oliver Wyman. I know that you are partner with the Health and Life Sciences Practices, and you're also the director of your brand new Leaders Alliance, the OHIC Leaders Alliance. So you have big job for Oliver Wyman, but happy to have you here.
Oh, it's fun. It's a lot of fun.
So Sam, we know that the main theme for this summit is the consumer imperative and how it is transforming the health industry from the outside in. What is it that makes consumerism that much more important to pay attention to now?
It's a great question. We've been talking about the consumer in healthcare for a very long time. Actually, the first commercial health insurance plan is more than 130 years old in the U.S. And when that came out, there was great press actually about consumers being involved in their own healthcare and employees being involved. When Medicare 52 years ago actually launched, there were people going door to door to sign up individuals in Medicare. We've had 40 plus years of clinical literature on shared decision making. We've had telemedicine being reimbursed for 17 years. Hasn't always been popular, but it's been reimbursable. And so it's a really good question. And why talk about the consumer now if we've been talking about them for a long time? And two things have really happened in healthcare. One, the amount of the healthcare cost that individual consumers are now paying, of their own healthcare costs, has now crossed the line where, as of last year, the typical commercially insured American, the person who pays all the bills and then some in the system, is in a high deductible healthcare plan, whether it's called that or not. And so they're paying more than $1,300 a year if they're an individual, several times that if they're a family. And what that means is, in most years, they're paying most of their own healthcare costs. Right? Most people aren't sick every year. Most people aren't going in every year. They certainly need insurance in those big years. But the rest of the time, they're going in and they're paying all of their own costs. And that fundamentally changes how they think about shopping for healthcare. Healthcare used to be when somebody else wasn't paying, was paying most of that money, when somebody else was covering most of it, consumers just chose, do I go to this hospital or this hospital or this hospital? Do I go to this doctor or this doctor? And now what they're saying is, do I get health care? Or do I get new tires? Or do I go on vacation? Or do I get a new iPhone? Or do I do any number of things that I need and want to support my life? And so now they're shopping for health care against everything else they buy with their own money. And so the onus is now on health care and healthcare providers like everybody at this event here at the summit to really be competitive with all of those other things that consumers see. The other reason I think we're talking about it now more than ever is it's actually easier to do that than ever. The cost of starting a digital health startup, which might have been $50 million just 10 years ago or 15 years ago, you can do for $500,000 and rent the data processing technology you need and the cloud platforms you need. We now have everyone who has a mobile phone in their pocket. And 10 years ago, the iPhone didn't exist. Couldn't have happened. And so we have all these ways that innovators can reach people, engage with people that are lower cost and more present, and that combination is a pretty powerful thing.
I agree, and obviously, you bring such wonderful speakers here, and there's so many different aspects that you're going to be exploring here over the summit. One of those I hope that you can kind of help flesh out for us is, we still have enterprises that are very inward focused. They have to meet their P&L, they're maybe more operations focused. How is it that we help them shift to having that consumerism focus?
That is the trillion-dollar question, quite literally in healthcare. And first, I think it starts with acknowledging that most people got into healthcare, whether they are clinicians providing care, they're IT people installing enablement, they are financiers who thought about health insurance, whatever their expertise, got into healthcare because they cared about people and they wanted to help people. Everyone who works in healthcare is a healthcare consumer themselves. And so what you can't start with is a healthcare's clueless, people just don't get it kind of attitude. We ended up here for a very good reason, which was we, over the past several decades, had huge growth in healthcare costs, and we built a system that was optimized around streamlining what we did to at least be operationally efficient. We saw lean move from Toyota into healthcare, and particularly hospitals, in a major way. We saw health insurers get ever better at segmenting the way their customers, big groups, segment. And so we ended up with a segmentation in health insurers that looks like what I call the Sizzler segmentation, which is how big's your party and are you over 65, right? Are you small, medium, large group, and are you a senior or not? And that wasn't an irrational thing. That's what you needed to do to survive in that world. And so part of what we now have to do is to say, healthcare adapted over the past several decades to serve a particular type of market, and we're going to embrace that kind of change is required now structurally. The other thing that's really required is moving away from this kind of fortress mentality. There has been a lot of activity in healthcare over the years to bring in more assets. If you're a health plan, you want to bring in other health plan and increasingly delivery assets. If you're a hospital, you bring in more hospitals because you get scale. If you're an IT company, you bring in all the modules that fit on your platform. And real consumer businesses don't own the whole fortress. They don't do that. Even the biggest retailers in the world that we think of a Walmart, think of an Amazon, get together every year with their suppliers.
Right.
They think about what's coming. They bring in innovative vendors. They view themselves as the one having a relationship with the consumer, but they don't have to build it all. Walmart doesn't manufacture its own stuff. Amazon sells as many, if not more, things that they don't actually make as they do, and it's a whole range, and it's a curator. And I think we've got to change that mindset as well.
You know, perfect examples for my next question. Do you think that the health industry really can ever convert itself to being a service industry?
So I think healthcare is a service industry, and we have people who act that way. One of the biggest challenges we have is we in healthcare have taken people who get into the business initially or say they want to get into the business because they want to help people. We then train them to treat diseases, not treat people. And then most of the time, we hammer them about coding and billing. And so you take somebody who's 22 and idealistic and wants to go to medical school or wants to go to nursing school or decides they're going to take their engineering degree and get into health IT, or is an actuary and decides that they're going to get into healthcare, who really does want to be in a service industry and help people. And we beat out of them that kind of motivation. And we have to change that. We have 60% of healthcare workers now across the industry self-identifying as burned out, saying that they're burned out, and a lot of the initiatives we're doing around better experience, being more consumer friendly, empowering people, we have to turn inward on our own employees before we're ever going to have an impact on the patients and customers we see. And I think we're getting there. We're starting to see some organizations really work that way, but that's going to be a big part of the change we need.
You know, and again, what makes the summit so special, and I'm so glad to have you here as one of the leaders of it, is that you really do address all parts of all the challenges that the health industry faces, including the employees and its mission, and really trying to address the burnout factor. So I know that we'll hear a lot more of your speakers in the coming days address those in particular. So I have one last question for you, though, Sam. Okay, how does innovation play a role in addressing the consumer imperative?
So, innovation and the consumer imperative are fundamentally intertwined and codependent, and I'm not sure that we can think about them as even separate topics. A lot of times, I think when people think about innovation, you think about the sexy stuff. You think about the shiny new objects. You think about the apps. You think about the kinds of things that are kind of space age, if I can use that terminology. But innovation is all of the things that we just talked about. Fundamentally thinking differently about the workforce. Do we need to train people for different jobs? Do we need to motivate them differently? Do we need to change what it looks like to provide healthcare? Innovation is about moving from this fortress mentality to having all the IT we need to make a seamless experience and a seamless front door for people. Innovation is about engaging people differently. Going to the doctor's office is one of the most inconvenient things that somebody can do. They tend to be open bankers' hours. Bankers' hours are now doctor's hours. Bankers actually are open more than doctors in most cases. They are in locations that may not be close to work or home. And we have incredible ways in every other industry of getting people access to what we want to provide to them without making them march in somewhere. And so I think innovation is going to, in healthcare, is going to be a combination of big innovation, the big scientific innovation that we see around drugs and delivery and personalized medicine, changing the science of what we do. It's going to be people innovation. We're going to have new roles and new professions. And if you and I are sitting here in 20 or 30 years, I'll be disappointed if we're just talking about doctors and nurses and not talking about a whole team of people who have different relationships with patients. And then it's about that kind of engagement innovation. It's about how do we reach people, how do we take the best things that other industries do and say, yes, those can work in healthcare, because it is now a consumer business. And I think that combination is going to get there. We're going to have a ton of failure. We have to get comfortable with that. But the bits that succeed, and I'm convinced there's at least a few that will succeed here at the summit, are going to fundamentally change the industry.
All right, well, Sam, such wonderful responses, and again, so excited to be here on location at the Oliver Wyman Health Innovation Summit. Thank you so much for joining us.
Thanks for having me, and thanks for being here. It's always great to have GuideWell.
Oh, we love being a part of it. My name is Kate Warnock. Thanks so much for watching. Hi everyone, and welcome back to the GuideWell Insights Lounge. We're here at the Oliver Wyman Health Innovation Summit. Hi everyone, my name is Kate Warnock, and I have with us right now GuideWell's president, Dr. Renee Lehrer. Renee, welcome.
Thank you. It's a pleasure to be here.
We're happy to have you here with us. So Renee, let's start with your first question. You're going to be talking at the summit. You're going to be on a panel talking about beyond the checklist and how do you really improve population health. Renee, what are some of the things that we really do need to address with population health so that we begin to transform that experience?
So population health, first off, is what it says. It's understanding your population. One of the things we'll talk about tomorrow is how we identify the population that we're dealing with. Who are those patients? What are their needs? What kind of experiences have they had in the past? Not just medical experiences, not just clinical experiences, but experiences in dealing with challenges of life. We want to know who they are. This is primarily, in this discussion, related to Medicare. So they're seniors. What have their experiences been? What's their health history been? Know who they are, and then identify who we can focus on, and then put together programs that really meet their needs, clinically, socially, psychologically, all aspects of it in a different methodology, supporting their primary care doctors, supporting the specialists, supporting the community of healthcare, surrounding them in a way that we really get to know who they are, what they need, and when we can have the greatest impact.
It really does seem to be a manifestation of one of the themes here, the biggest theme for the Oliver Wyman Health Innovation Summit, which is the consumer imperative and how it's transforming healthcare. So clearly you're a step ahead already in addressing that consumer in such a holistic way. So Renee, I just came across an article, our next question. It's a New York Times article that said that loneliness in the senior population is a greater indicator of early morbidity than obesity. What is it that GuideWell is doing with its partner Lyman Healthcare in addressing these social needs of this population?
So the lack of social interaction in this population is an incredible challenge for these folks. They're totally isolated. So not only are their medical problems a challenge because of their age or because of medical history that they've had, they're on their own. They're often living alone, they're by themselves, they don't feel that they're being cared for, that someone cares about them. So one of our goals, again, is to understand holistically who these patients are, what are their needs, how do we bring all their needs to them so that we can improve their livelihood, not just from a clinical perspective, because the reality is it's not about managing their health care. It's about giving them a supportive environment so that they can have some enjoyment in life, which goes well beyond writing prescriptions or seeing clinicians. It really has to do with their lifestyle, getting out, appropriate nutrition, appropriate even drinking, opening up a refrigerator, seeing some food in there, and constant interaction with people, so that we now have dashboards with companies we're working with that we follow. We know what they're doing. We know if they're leaving their house. We know who they're interacting with. We will be able to tell, are they on the phone or are they truly isolated, so we can target that population.
In previous conversations with you, Renee, I know that you've talked about this, it's very high tech, but also very high touch. So you're really enabling technology to come into the home in a very non-invasive way, again, to make sure that they're doing those behaviors that you want to see, and making sure that if they're not, that you're able to intercept maybe some negative situation.
So you think of technology as an introduction to interaction. Technology gives us the opportunity to interact with the member and pick the members that need it. The technology is great from a clinical perspective, but the social interaction is really what the member wants.
Right. Well, one final question for you, Renee.
Sure.
So just last month, we had a really exciting event at the GuideWell UST Global Innovation Center, and that was the Greater Than Cancer Immersion event. It was a 2-day event, and you there were a member and sat in the audience. We got to interview you there. I was hoping you could maybe connect for us, here we are at the summit. What might the audience hear want to know about this immersion experience so that we can have the folks that are here at the summit maybe kind of join where we are with this immersion event, which is in the 6-month journey. Why don't you tell us a little bit
So
more?
the immersion event was a first of its kind program where we really not just had lectures about patients with cancer, this was about cancer, but saw cancer from the perspective of everyone involved, from the family member to the patient themselves, to the doctors, to the community leaders, to groups that were just being support groups. It was really an opportunity for people to contribute and add, and it was not an environment where people just lecture. So as we now move into the next environment, if you think about what's happening here with consumer engagement is the ultimate for the cancer patient. Sure. Again, if anyone feels isolated and feels alone in their journey, often it's a cancer patient. If we can take what we're learning here to further the immersion event over the next few months so that we can truly understand the experience of all the caregivers and all the patients, what we learned at the immersion event was it was almost more difficult for the caregivers as they experienced the pain of their patients. If we can identify ways to communicate, interact, and engage members and all of those involved in the management of cancer patients, we'll move a long way. So hopefully what we learn here over the next few days, we can adopt, bring some of the skill sets, bring some of the people, and emerge them into this immersion event.
Perfect. Well, that's an open invitation for anyone who hears this interview. Please find out more about this event at GuideWellInnovation.com. Well, Renee, thank you so much for joining us here at the GuideWell Insights Lounge. My name is Kate Warnock. Thank you so much for watching.
Thank you.
Hi everyone, and welcome back to the GuideWell Insights Lounge. We're here at the Oliver Wyman Health Innovation Summit. My name is Kate Warnock, and I'm delighted to bring our next guest, Dr. Kent Bradley. Dr. Bradley, welcome to the interview.
Thanks, it's great to be here.
We're happy to have you, especially you just came in from all your travels, so glad that you're here with us. So, Dr. Bradley, you are the founder and managing principal of BTN Advisors. All right, let's start with your first question. You're going to help open the summit tomorrow by speaking on the subject of making engagement make business sense. What are your top points going to be?
Well, I think in the area, everyone talks about engagement, right? So they, in fact, Health Affairs put this piece out that engagement's the next blockbuster drug. I think the point that I'm going to be making is that we don't necessarily think about engagement as actually getting to understand the individual, their wants and needs, and how to really deliver something that's important to them, which is a relationship, and that communication to engender that relationship. So I'll be talking a little bit about one particular company that I advise, and that company's Frame Health, where they've been focused on looking at one's personality and the richness of that engagement that occurs that we already understand in the human resources and in the job selection arena, where, you know, as I get to know you and I can then coach you better, or as a leader, the more I am aware of who I am, the better leader I am. How can that same dynamic of getting to understand a person's personality improve the clinical experience?
That sounds fascinating. It's going to be a great case study, I'm sure. Yeah. So, all right, next question for you. As I was kind of doing some research on you, Dr. Bradley, I came across an article that you had published on LinkedIn, and it was titled "The Things We Don't Speak About." And you name a novel solution for what Alexandra Drain, one of your panel partners, terms the unmentionables. Tell us more about the approach that you came up with to address the unmentionables.
Well, first off, I don't take any credit for the concept of the unmentionables. That's Alex and her work and study that reveal that there are a lot of different things that we don't like to talk about, and in those areas that we don't talk about, they actually significantly impact our health and well-being. And that there are certain things that can enhance the possibility of having a bad health event, or things that can buffer you in that experience. What I've been focusing on, really spending a lot of my, if you will, my discretionary time, my passion time, is around the support of work that focuses on how do we get people first aware and beginning a conversation, and what is accessible. And to me, what's accessible to all is music. And so it's the use of music and video to really hone in on the engagement of a particular issue to start the conversation. I just think that, and this is through video, so visual storytelling, but through music. I think that's an untapped area. When we think of how we normally market, it's usually with a particular agenda perspective versus just allowing the music to be the thing that brings people in, and then through music starting a conversation.
I love it. So definitely recommend everyone find that article on LinkedIn and click through, because I know that you link back out. All right. So again, going back to your background, Dr. Bradley, your career followed a trajectory from the military to now advising cloud-based companies and fostering artist communities. What has translated among all of those moves in your career?
I think the fundamental thing that's driven me throughout my career, and I imagine it's true for most people, and that is the importance of wherever I'm at. We all yearn for a relationship. We all yearn for meaning, and whether I was in a military serving, whether I was working as a consultant, working with clients, working on nonprofit arenas, the thing that connects them all, that actually connects to the issue of engagement, is the power of relationship. And I think I have a concern as well that as we increasingly become connected, which is critically important and is in fact an accelerator of a lot of good, there's also this concern that we are becoming increasingly less connected in a human sense. And so how do we nurture those relationships? And what's translated across everyone is this aspect that at the end of the day, we're in a people business and people matter, and we have to translate that into relationships and how we provide meaning in what we do.
And I love about your response here, Dr. Bradley. One of the overarching themes for the summit is the consumer imperative. So as you frame that out, you're talking about relationships. You're talking about the right way to connect people through music. Kind of a novel approach, but speaks to emotion. I think that you really are you're putting solutions into place that does put that consumer right in the center, which is where they always belonged.
Well, thanks.
So it's exciting again to explore your career and your current position. So our final question for you, Dr. Bradley, what has you most excited about how consumerism is transforming healthcare from the outside in?
Well, I think the whole area of consumerism really is understanding the person-centeredness of this, and recognizing that if we really believe in the consumerism movement that we see in healthcare, what we're really getting at is the empowerment of people. And I believe whenever people take back that locus of control and they feel empowered, that can translate to so many other aspects of their lives. And in the area of health, it really can help with not only their experience of care, which we need to be very cognizant of, it also can improve their health journey in and of itself. So if there's anything about the outside in is from consumerism, is the fact that we're thinking about how to better empower individuals to lead the life that they want to lead.
I just did think of a little PS, a little postscript that I have to ask you. Give folks the meaning behind your current company, BTN Advisors.
Oh, so I was in a period of transition, and I decided to do some advisor work. Long story, but I had to think of a name, right? Right. And so the story, there's a quote by Mozart that music isn't in the notes, but it's between the notes, and so BTN really stands for between the notes, and how I think often we get so focused on that which we see, and we don't understand that the tempo through which things are delivered, the tone, everything that's in that white space between the notes really makes a big difference.
Yeah. Well, thank you so much for sharing your story with us, and I think that we're going to continue to hear so many fascinating stories here from the Oliver Wyman Health Innovation Summit, and I'm delighted to bring those speakers here to you at the GuideWell Insights Lounge. So Dr. Bradley, thank you for your time. My name is Kate Warnock. Thank you so much for watching. Hi everyone, and welcome back to the GuideWell Insights Lounge, We're here on location at the Oliver Wyman Health Innovation Summit. Hi everyone, my name is Kate Warnock, and I'm so pleased to bring our next guest, Sean Duffy. Sean, welcome to the interview.
Thank you, Kate. Happy to be here.
We're happy to have you. Sean is the co-founder and CEO of Omada Health. So Sean, I was looking into your company and your background, and tell me, what is the gap that Omada Health helps to fill for people who are suffering from chronic diseases?
So as you gain weight, your body reacts, and it tends to lead you more toward chronic diseases like diabetes, heart disease, et cetera. And there's this amazing body of literature and science that shows that intervening in the right way for the right people at the brink of chronic diseases like diabetes can make a big impact in their risk reduction. So, my background's a mix of tech and medicine, and in medical school, I remember I just kept reading about all these fabulous clinical studies that show what you can do. Yet, before Omada, the vast majority of programs that could be delivered for people are done in person, which creates its own whole host of challenges because they require multiple touch points, et cetera, and it's really hard to get people into a physical setting for these. And so Omada is, filling that enormous hole of being able to scale these interventions and deliver them on the other end of an internet connection with similar or better efficacy.
And everything that you're doing is all evidence-based, isn't it? So, a lot of research has gone into the model that you've developed. Do you want to tell us a little bit more about that?
Yeah, so the clinical backstory is that in 2002, this amazing clinical trial came out called the Diabetes Prevention Program. And they took 3,000 people with prediabetes, so at high risk for type 2, and they randomized them. And for 1,000, they brought them through a very high-touch program in person that targeted a modest amount of weight loss done in the right way. It's a very behaviorally forward way to help people make lifestyle change. Then they tried a drug, and then they had what is unfortunately standard of care in the country still, which is handing the curriculum to someone and just praying that they go off and make changes on their own, which doesn't happen.
Right.
So the program had the best results of all these arms. There was a 58% risk reduction in the conversion from prediabetes into type 2, and it kicked off this fabulous cascade of clinicians wanting to bring these insights to bear, and every bit of our program is based on that body of evidence.
Terrific. Well, one thing that I was also researching about Omada, I think that you recently posted a blog, and it was all about alignment of payment, so payment that enables innovation. And you cited even CMS's payment for diabetes prevention programs as proof. So how can funding continue to improve population health?
Well, what's interesting, about the payment in the space at large is it's really one of the, kind of a shining example of outcomes-based pricing. Omada, when we first started, we had an outcomes-based pricing model. It was funny. At the time, I had worked in tech before heading to medical school, and when I started the company, that just seemed so obvious. I think I didn't know how innovative it actually was looking back, but we just decided to price on our outcomes. At Omada, we match people into groups. We get them a scale that's got verified and validated data coming back in, and I figured if that's the clinical endpoint that the community at large assigns value to, why don't we charge for that? And in this space at large, value-based arrangements and outcomes-based pricing are more common than other areas, and CMS took foot there, and their pricing model that they're shaping for benefits design launch on 1/1/18 is going to be outcomes-based, and it's we hope that there's a lot of other interventions and programs that follow suit.
You're really leading the way, though, and how exciting to be in this space and with the experience that you've got. I wanted to pivot a little bit, Sean, about your background.
Yeah.
You've mentioned being on the tech side. When looking at your resume up on LinkedIn, you've worked at Google, you've worked at IDEO, you've done MedGadget. All of this experience really seems to have positioned you perfectly for your position in founding Omada Health. So tell me what experience has translated into the company that you run today.
Well, it's funny. So I grew up in Colorado. My dad was an engineer. My mom was a nurse. So I've always been somewhat of a hybrid between kind of a tech geek and just drawn to healthcare, just for the simple reason it felt like a great way to help people.
Yeah.
So I studied neuroscience in undergrad, neuroscience and behavior at Columbia. Graduated at a point where Silicon Valley was just blooming. It was an incredible moment in tech history, and I'd done all the pre-med recs. I was thinking about maybe going to med school, but at my core, I just felt drawn to technology. So I worked at Google for a couple of years, had the ambition to do something in the tech meets primary care space. Went off to medical school, then while in medical school, took an internship at IDEO that led to the company. And what I've always felt I can most do to serve not only our company internally, but just ideally the community at large, is help build bridges between the tech world, which used to be over here, and the healthcare world, which used to be over here, and increasingly there's convergence.
Yeah.
And it's a beautiful thing when you have executives at your company that, prior to Omada, they ran all of post-enterprise sale for Google Apps, and this is their first healthcare gig. And then for others, prior to Omada, they led the commercial organization for Counsel. This is their first tech gig. So
Right.
that blend, I think, is powerful for not just what we do, but is one of, in my mind, the least talked about and most interesting things that's happening right now to dramatically catalyze innovation in healthcare and spawn a whole host of new ways for delivery.
Well, that's really exciting. I mean, that's absolutely, it's so much about really what the summit is even about here is talking about the consumer
Yep.
imperative and who are the players that really have
Sure,
to contribute
exactly.
to that. So,
No, totally.
one more question for you.
Yeah.
So, as I just mentioned, Oliver Wyman has convened all of these industry leaders here at the summit to discuss how healthcare can be transformed from the outside in. What's the role of the primary care doctor in this transformation?
I mean, it's funny, for us, we love to be thought of as almost like a specialty center for these programs. And when a primary care doc who may feel powerless to help a person make lifestyle change, help a patient lose weight, to refer into us and trust us to deliver all the needed multi-component bits to ensure success with a person is a fabulous result. So we want to engage at that level. I also think, but at a more meta level, the concept of primary care is dramatically shifting. I think primary care of tomorrow will be thought of slightly less as a specialty and more as a concept, in that you will build, as a patient, a primary care brand affinity with a health system, maybe a Mayo, a Sutter, and the way that system routes you, cares for you, introduces the right people, manages acute, things that pop up in your daily life, manages chronic, you'll feel that as a patient as primary care. So I think that's already starting to happen in many ways, and will continue. And Omada's job always in engaging either at the PCP level or at the system level is to be thought of as where someone can be sent when it's clear that their weight's caught up to them to the point where they're now having early cardiometabolic problems.
Right. So it sounds like you're really presenting a future that continuity of care, the continuum of care, really is much more integrated and seamless, which really is so much better for the patient at the long run. So,
And I think it'll happen. I think technology and
fingers
innovators here
crossed,
can
right?
get there. So.
Right. Well, Sean, thank you so much
Sure.
for your time here today with
Happy
us
to.
at the GuideWell Insights Lounge. My name is Kate Warnock. Thank you so much for
Great.
watching. Hi everyone, and welcome back to the GuideWell Insights Lounge. We're here on location at the Oliver Wyman Health Innovation Summit. My name is Kate Warnock, and I'm pleased to bring you our next guest, Todd Van Tol. Todd, welcome.
Thank you very much, Kate.
We're happy to have you. Todd, you are partner and head of North America for Health and Life Sciences at Oliver Wyman. We're happy to have you again because I know that we've interviewed you in the past, and it's good to kind of refresh your perspective on some things. So let's ask our first question. One of the big themes for the summit is transforming healthcare from the outside in. Why is it that our industry continues to lag behind in that transformation?
I think it's important to understand when we say outside in, we mean finally coming around to building models and products and support that really centers around the consumer. We have so much in healthcare that has been inside out. We have operated under things like provider workflow, payer systems, what employers have wanted in their benefits, and the consumer's been a bit of an afterthought. They've been in the background. As you think about what are the types of things we measure and how we pay, it's been things like procedures, it's been claims. We've made it episodic, and people don't live their lives, they don't have their healthcare experience, they don't have their healthcare journey in episodic bits. And as you start to think about and compare to what really good outside-in industries, really consumer-centric industries and leaders within that do, think of things like retail or the hotel industry, and how they really think about those points of joy, of magnetism, thinking about consumer segmentation and how meeting people at different places in different ways do that. Amazon's a wonderful example in terms of how they use technology. Yes, we are transacting. Yes, we have events where we're purchasing items, but Amazon makes it easy. They understand our preferences. They're anticipatory, very personalized, and that is a foreign concept to healthcare. So it is just in the last few years that we have really started to center on let's put the consumer at the center, let's think about their needs, and let's start to design something that's not about the transactions and the points in time, but something that is end-to-end in that journey. And we've got a ways to go, but you're starting to see the emergence of things like the consumer experience officer in a large health system or in a payer. And we're getting there, and it's been the growth of things like Medicare Advantage, ACA, and other consumer choice markets that is going to let us put that consumer at the front and center.
All right, so you just named some really, really great examples for us. Let's feed that into our next question. So building, and you even use the word magnetic, building a truly transformative and magnetic consumer model is difficult. What is the difference between what you've seen most organizations do versus what you view as true transformation?
Yes. You started with an important word. It is difficult. Let's acknowledge that healthcare has certain unique challenges that make that transformation perhaps a little bit more difficult than some of the other industries that I've highlighted. So we have challenges around health literacy, right? Healthcare is complicated, it's personal. We're dealing with important choices, often at times where we have fairly significant needs, physically, emotionally. We have a significant amount of regulation, our industry is somewhat fragmented, and so some of the changes that can scale quickly, technology-driven change in other industries, sometimes happen a little bit more slowly in healthcare. And I think we're seeing people nibble on the edges. Everybody has some patient engagement, consumer experience initiatives that they're running, but often they fall in the bucket of how do we fix existing pieces and parts? How do we improve that EOB? How do we make that process of discharge a little bit better and easier to understand? We're working pieces and parts, or even with good intent, sometimes we're adding more. So we're putting more decision support tools, we're rolling out another app. And even though we're putting more functionality into the consumer's hands, we're not really making it easier. We're in some ways we can even make it more fragmented, more complex, because we're throwing more stuff at them in the hopes that something will stick. And so that's incremental in doing and fixing some of those pieces and parts. Transformative, again, goes to thinking about the end-to-end journey. What is somebody, as you just think about the healthcare experience, whether you're a payer and thinking about how do they understand their needs, understand their benefit options, make good choices, understand how to use them, to somebody receiving a diagnosis and understanding what their options are and treatment options available to them and what it means to comply and things of that sort. These are things that don't happen in piecemeal components, but they're things that require an understanding of a journey and the hassles along the way. And really transformative requires working all of those components, and it often requires working in a cross-stakeholder way.
Well, perfect lead into the next question, as you mentioned, working across stakeholders. Obviously, the nature of the payer-provider relationship is changing to create a let me rephrase that. How is the nature of the payer-provider relationship something that maybe was once contentious and maybe now a little more collaborative? How is that changing to really enrich the consumer experience?
Getting there.
Yeah.
There's still, at times, plenty of friction in that, but it historically has been one. It's been a bit of a zero-sum game, right? It's been about unit rates and the contracting mechanism, and if I give you more, I get less type of dynamics. I think in some ways, ACA and the ACA markets maybe even exacerbated that a bit because we had a lot of pressure to hit price points. We have very price-sensitive consumers who have shown a willingness at times to trade access in terms of the size of the network for lower premiums, and so in some ways we've been trading on some of those old tools. But what's begun to emerge is organizations in collaboration saying, that's not sustainable. Let's really think about how we break this kind of race to the bottom and the idea that lower price means less choice and a smaller network, and think about how we differentiate on experience. Think about an example like AARP, another insurance sector. We are not talking about something that is a new iPhone or a gadget of some sort. It's insurance, but yet you have members there who 90% plus said they're going to stay with AARP for life. So how do we create that in healthcare? And you can't do it alone. It's very much a team sport. So as you think about again, that end-to-end journey of a consumer, they're not breaking it apart and here's the interactions with the payer, here's the interactions with the provider or in the physician's office. They're thinking about that holistically. So we are finally seeing payer and provider organizations saying, well, let's launch a new product offering. Let's go to market with something that actually has a focus on experience. Let's make it easier when I'm in the office to schedule that follow-up appointment. Let's open up the access so that I can get the specialist appointment so that my medical record can follow me from different locations. How do I go from 10 numbers on the back of my insurance card to one number? And how do I think about eliminating surprises and the things that happen in healthcare today where we generate the negative experience because we have a surprise that's out of line with our expectations. And so there's a number of organizations and partnerships that are emerging out there that are focused on creating a great experience and saying, and that's going to create loyalty, and that's going to cause us to get out of this churn in terms of this race to the bottom on price and actually have something that's differentiated and sustainable.
And we'll see efficiencies and really put that consumer back in the center where they were supposed to be all along.
That's right.
Right. Well, Todd, thank you so much for sharing your insights with us here at the GuideWell Insights Lounge. My name is Kate Warnock. Thank you so much for watching. Hi everyone, and welcome back to the GuideWell Insights Lounge. We're here on location at the Oliver Wyman Health Innovation Summit. My name is Kate Warnock, and I'm so pleased to bring our next guest, Josh Michelson. Josh, welcome to the interview.
Thank you for having me.
We're happy to have you. So Josh, you are a partner for the Health and Life Science Practices and, got a second title, Director of the OHIC Leaders Alliance for Oliver Wyman. So, big job. And we're glad that you made some time to spend with us here.
Absolutely.
All right, so let's talk about one of the big themes here at the summit, Josh, and that's around population health. How would you describe population health, and is it different from community health?
It's a good question. You know, it's certainly a buzz. Both are buzzwords in the industry, and they're linked. But I do draw a little bit of a distinction between the two. So when I think of population health, at least as the industry thinks about population health, it's four pieces. So one is it's about actually improving, the triple aim, so quality, cost, and the experience. It's for a defined population. So, you are trying to improve, those pieces for a specific population. It could be quite micro, so it could be around, Medicaid or Medicare or commercial, or it could be all encompassing. I think population health has a third piece, which is it's much more of a holistic approach to care. So you're not just receiving the patient, but you are proactively trying to improve their health. And the third piece is that whatever organization is kind of responsible for that population, they're actively at risk for it, right? So they're financially at risk. So that's kind of how I would think about population health, at least from an industry standpoint. And so community health is similar, but I think it's a little bit different in that it's the foundation on which people are kind of trying to improve the health of a specific population. So in a community, it's about all the social determinants of that community. It's about economic vitality, it's about some of the structural impediments, and it's about social impediments. And so while I think in a given community, take Chicago, in a pocket of Chicago, if you were trying to improve kind of the community health and really lay the foundation for that, you might take a specific kind of subpopulation and laser in and have a provider or a payer or an organization responsible for the cost, quality, and experience. But I think the community health is a much broader and more kind of public health oriented ambition.
Is it fair to say, is community health more location-based? Is it more about a geographic region versus population health, which doesn't have necessarily the same borders?
Yeah, that's probably a fair way to think about it. Most organizations here, and we were studying a little bit of what's in the mission. So we looked at the mission statement of payers and providers and health IT organizations, and what we found was that organizations that had kind of roots in a specific community or a specific market tended to gravitate to words like improve the health of their community or the individuals that they serve versus those that are kind of location independent, and those that are kind of more location independent didn't quite draw that same connection. And so I do think being able to kind of put your arms around a geography or a microgeography is certainly an important attribute.
Okay, all right, fair enough. Next question for you then, Josh. Who are the constituents required to drive better health for the community? We have a lot of players here at the summit. Who really is going to make a change in transforming the healthcare that we want to see?
Well, we have many organizations here that happen to be some of the largest employers in their market. So whether it's hospitals or payers, they tend to be in the top 2 or 3 organizations in terms of employing individuals. So they're naturally an anchor, and there's kind of this notion of an anchor in the community that you can rally around. But I think it's a lot broader than that. So, some of the first steps in kind of transforming the health of the community is first connecting the organizations that are responsible for care. So it's not just the hospitals and it's not just the physicians, it's the safety nets, it's the FQHCs, it's social services, and you start to kind of orient around that anchor, and then you kind of broaden it, you start to say, well, who else is there? It's the retailers that have a role, it's education that has a role, it's the churches that have a role, and the religious affiliations. And so what we've observed is that some organizations are really saying, well, what could we do to connect the care? And other communities and other organizations are starting to say, wait a second, if we're thinking about the social determinants, who plays a role in the social determinants? And then the third layer is, many community health improvement initiatives really start with the organizations that have a physical presence. And what we're seeing is that there's an opportunity to pull in innovators and technology companies to actually assemble, the supply side a little bit differently. So it's not just, a provider in a market that has a new care model. It's what would happen if you actually incorporated the provider with consumer tech and engagement around specific populations. And we think there's a lot of promise in actually attracting innovators to test their models and refine their models through community health initiatives. So it's quite broad, but we do think it's important to have an anchor that can serve as a facilitator and really help rally investment and energy across multiple organizations.
As you give your response, Josh, I can't help but think that with so many players involved in this, that really does speak to the complexity of really managing true health and helping people, focus not just on, episodic care, but that holistic vision that you painted for us in the beginning. So just one of the challenges, but, so many opportunities too when you have the right people involved. So we have one more question for you, Josh. So what new business models or collaborations are you seeing emerge as a result of organizations wanting to make a substantial impact on the health of their communities?
So, I guess a couple things. One, we're seeing organizations rally around kind of a major cause. So whether it's something like hunger or employment, we're seeing some healthcare organizations say, we're going to find an issue and rally around that issue and be quite systemic about it. So take hunger as an example. The role of a provider could actually be creating as part of their care pathways, nutrition plans, and then tying into what restaurants are doing in the community and addressing food deserts. And so taking an issue like that and actually marbling a set of solutions around a specific issue. We're seeing other instances where, it's actually city-led. And so the government is going to come in, and Chicago is an example of this. They have invested in Healthy Community or Healthy Chicago 2.0. And so they are inciting or asking multiple constituents in a market to rally around multiple issues. So it's much more diverse in the set of issues that they're taking. And then the third thing, which I haven't seen take place, but I would love to, is, and we're here talking about it, this idea of health and wellness, right? So we have sick care and we have kind of preventative, proactive care and engagement. And we think there's an opportunity for organizations in a market in a specific geography to create a new marketplace, so a marketplace for health and wellness. So if a community were actually able to build up demand at scale, so have employers or multiple employers rally around kind of a new supply side. So not just buy the traditional provider and the traditional network through the traditional plan of benefits, but have a payer or an employer wrap a product around the new supply. So a creative assembly of the supply, and have traditional organizations actually integrate their solutions with some of the innovators that we have in the room, and then have a new marketplace around that, and have that sit side by side with the traditional, and hopefully build up demand and show that this alternative model is possible. So that's where we're hoping this goes, or at least personally where I hope this goes.
I got to ask, so timeline for something like that, is this something a year or two out, or are we looking 3 to 5 years? Because that sounds, it's a very, I love the idea of that kind of model. Realistically, how long might it take to really get something like that to begin to build traction?
Well, so what we've observed in the market is anytime you're trying to bring a new product, even take a payer that's moving into Medicare Advantage space and trying to build adoption, you don't go from 0 lives to tens of thousands of lives or hundreds of thousands, so that can take a while. What we're hoping is that transparency around the effectiveness of those solutions is something that helps influence it.
It's its own best marketing, right?
And then we are seeing examples of smaller communities, maybe not large metropolitan communities, but smaller communities bring government, public health, providers, banking, transportation, kind of all sectors together. And in that smaller microcosm, they've been able to do it, but in part because they control many of the levers. Whereas in a marketplace like Chicago, it's a lot harder to do that. So we're hoping that at least in pockets, we're able to see that kind of new supply rise, where it's many organizations coming together and then buying that in a more packaged way.
Okay. Josh, you paint a really, really fascinating look ahead into the future of healthcare, and I appreciate you spending your time and your insights with us here at the GuideWell Insights Lounge. Thank you. My name is Kate Warnock. Thank you so much for watching.
Thank you so much.
Hi everyone, and welcome back to the GuideWell Insights Lounge. We're here on location at the Oliver Wyman Health Innovation Summit. My name is Kate Warnock, and I have our next guest, Mr. Robert Vorhoff. Robert, welcome.
Thanks for having me.
Robert is the Managing Director and Head of Global Health for General Atlantic. General Atlantic, being a participant here at the Oliver Wyman Summit, you have a very specific perspective that I think is unique from some of the other players here. So being a global growth equity firm, is that right?
That's right.
We
yeah,
got it
thank
right.
You. Yeah.
Global growth equity firm. You're probably seeing the summit maybe through a different lens. What are some of the things that you're going to keep an eye out for here at the summit?
Yeah, first of all, thanks for having me. It's a pleasure to be here. There are endless investor conferences throughout the year, and frankly, there's not enough time to attend them all. And so when I think about which are the ones that are most impactful, there are probably 3 that I don't miss. This is one of the 2 that are really more subject matter focused. It's a great gathering of leaders across the industry. It's an opportunity to meet with innovators and how they're thinking about solving big problems. And it's a relatively close setting, so there aren't thousands and thousands of people there. So you're getting to have great, conversations in these rooms about what are people trying to do, how are they trying to innovate, what are the problems they're trying to solve. And it's a great opportunity for us just to network and sort of bring talent around our portfolio companies and identify new investment opportunities.
Well, terrific. So Robert, we've had a lot of speakers already come and kind of address how they're going to see, they anticipate that transformation from the outside in for the health industry really isn't going to come from traditional players. Again, from your perspective with General Atlantic, what are the sectors that you think we might begin to see disruption come from that is going to transform the health industry?
Yeah, we debate this a lot. So growth equity, right, you're always betting on innovation. It's always betting on transformation to some degree. And there are a lot of new companies that are very exciting. They're more technology enabled. But frankly, they don't come with as proven of a business model. And one of the things we look for is things that are bringing innovation, but they're within a proven revenue construct. So they're technology-enabled service companies, or they're traditional companies that have a proven revenue model, but they're leveraging technology in a way to change the basis of competition or the scalability of that business. and it probably sounds a little vague. Maybe I'll highlight some of the areas where we focus, some of the trends or
Terrific.
theses that are interesting. I think a big part of it is trying to find ways to provide better access to needy populations. So if you think about Medicare eligible or Medicaid, these are populations that are not getting adequate access or coordination of care. We're trying to think about models that, one, provide better access, but two, find a way to coordinate and deliver that care in a more efficient way that's saving the system money.
Okay, so efficiencies obviously that would help yield better outcome and allow that quality score also to go up. So that's a great focus, and I know something that will be talked through here at the summit.
Yeah.
One more question for you, Robert.
Right.
I know that there are so many companies that would love to have a seat where I am sitting right now to kind of pick your brain as to what makes a successful bid, maybe if they're trying to get the attention of General Atlantic. What are some of the things that you look for in a potential client before you begin investing?
That's a great question. So a passion to solve a big problem, right? We don't look for marginal improvements. We're looking for big change, a track record of success, and an ability to recruit success around them and building their teams. Proven business models, an ability to scale those models, and frankly, just an openness and a willingness to bring on a partner and to work together to try and accomplish those goals.
So it really is about collaboration and
Correct,
listening
yeah.
to the experience that you bring to the table as well.
Yeah.
Yeah. Well, we're delighted to have you here at the summit and at the GuideWell Insights Lounge. So thank you for making time for us.
I really appreciate it. Thank
We're
you.
happy to have you, Robert. So my name is Kate Warnock. Thank you so much for watching. Hi, everyone, and welcome to the GuideWell Insights Lounge. We're here on location at the Oliver Wyman Health Innovation Summit. My name is Kate Warnock, and I'm so pleased to bring a social media maven to our set. Her name is Jen Denard. Jen, welcome to the interview.
Thank you for having me.
Jen is the founder of Health IT Chicks, and you have done a number of things in your career. Let's talk a little bit first about this amazing community that you have started, and you're going to be featuring a guest today on your Health IT Chat, I think at noon
right.
Central Time. Why don't you tee that up for us and tell us a little bit more about it?
Well, Health IT Chicks got its start about 4 years ago as a tweet chat. I just noticed that there was a lot of energy around women on Twitter using social to connect who are working in healthcare technology. It's just growing out like gangbusters. We have a LinkedIn group with about 400 plus women and men. We have monthly tweet chats, and the folks at Oliver Wyman were kind enough to invite me to have our monthly chat here at the summit. So I'm so excited that Sukanya Soderland of Oliver Wyman is going to be hosting. So she and I are going to get together downstairs in just a little bit and do a tweet chat / meet up. So it's going to be in real life and online. So it's going to be great. She's really excited about talking about digital and its impact in healthcare. She's going to bring a very unique payer perspective, which we haven't had in the past. So I'm excited to see what she'll generate as far as conversation topics.
Sukanya is fantastic. We were able to interview her at AHIP this year, so I
Okay.
think that you're going to have such wonderful content for your audience. So for folks who are interested in following along, tell them the hashtag.
The hashtag is Health IT Chicks.
Easy enough.
CHICKS.
Perfect.
We have a LinkedIn group. Just Google that and you'll find it. And yeah, follow the hashtag. We have monthly chats. We do in-person events occasionally. So check us out.
All right. Well, Jen, again, looking back at your background, you've identified, and it's unfortunate that there is such a disconnect in gender representation, especially around healthcare IT. What are some of the solutions that you've identified that will help close that gap?
Well, in talking with other women, organizations, men about the issue, which really seems to have kind of bubbled up and gained steam over the last year and a half, it all starts with awareness and benchmarking. So taking a look at what your individual organization is doing in terms of wage, if there's a wage disparity, the number of women that are in the C-suite on your board, what's the pipeline like to internally promote women within your organization? Do you have the resources to help propel women forward, even women who are re-entering the workforce after they've taken time off for having kids? So it's important to kind of set a benchmark. And I don't know if you and your viewers are aware of an organization called HIMSS, but they have done a fantastic longitudinal study looking at wage differences, I believe, between 2006 and 2015. So it's a pretty big study,
Yeah.
and it shows that the wage gap is actually widening year over year. And so that's a good place to start. Take that to your employer and say, hey, you should be aware of this. You know, what are we doing to kind of diffuse that and reduce that gap? So.
Excellent. Well, I think, again, with the guests that you bring on your chat, the conversations that you have, it really does help to educate people on the issues and maybe hopefully empower them to see these women in a leadership position, inspire them to take their own action.
I hope so.
I hope so too. So you have recently branched out a little bit. You're not just on Twitter and on LinkedIn. You are now co-host of HITcast.
That's right.
And I wondered, what is it that you were hoping to gain by going into that podcast medium? What were some of your goals?
Well, I don't like to be bored. Podcasting is something that's obviously been around for a while. I decided, I need to flex my creative muscles, learn a new skill, and the folks at Health Standards, which is a fantastic blog for folks working in healthcare IT, they reached out and said, hey, how about you be the co-host with my good friend Chad Johnson? And so we've wrapped up our first season, I guess about a month or so ago. Our second season is going to be launching in November with Dell's Chief Medical Officer, Dr. Nick Van Terheyden.
Yes. Dr. Nick, at Dr. Nick on Twitter.
Dr. Nick,
yes.
yeah, he's fantastic. So do listen in for that. He's got some really great tips on how to select the proper whiskey and scotch. So
Who doesn't want to hear that? Really?
Lots of good stuff.
So it's fun, but it's also really great content. Having listened to several of your podcasts, highly recommend it. You can find it on iTunes and on Google Play too, correct?
That's right.
One last question for you, Jen. You've been watching health IT trends for years, and I wonder what has you most excited about how we can really help transform the healthcare industry from the outside in. It's one of the major overarching themes for the Oliver Wyman Health Innovation Summit. What has you excited, and what do you think can really help us really move that engagement forward?
I am really excited about the intersection of behavioral health and primary care. Mental health care is something that has not been talked about, and now it seems that people, patients, consumers, what have you, providers are getting more comfortable with saying we need these resources available to us. And there's some great telemedicine companies that are doing work with behavioral health. I had the opportunity to go on an Oliver Wyman immersion tour yesterday. We went to Oak Street Health, which is a primary care clinic for Medicare patients, and they are doing telepsychiatry for their patient population. So to me, there's a need across all age groups, all income levels. If you haven't had mental health issues, chances are you know someone who has.
Right.
And it's not something that people think they can easily go find care for. So to see these companies coming up with either text-based messaging apps specifically for mental health care or telemedicine solutions, I think is very exciting.
I love that you really singled that trend out because we just have Alexandra Drain is one of the speakers, and she's moderating a panel right now here at the summit all around how human connection and empathy is so critical to any kind of engagement, and how that makes business sense, but it just makes human sense, doesn't it?
I agree.
Yes.
I agree.
So, and one more plug, talking about mental health, GuideWell Innovation is going to be hosting an immersion event in August of next year around mental health and how we can help really improve the experience, and we're looking at it from many different angles, from payers, providers, patients, and caregivers too. So I would love to get you involved in that conversation.
Would be great.
And anyone who is watching us now, check us out at GuideWellInnovation.com. Well, Jen, you have been fantastic here on the lounge, and let's have you again give one more, the specifics around the chat that you're going to be hosting today and how folks can find you.
The chat kicks off at 12 noon Central Time. It'll last an hour. In person, it'll be about 30 minutes.
Perfect.
And look for us on LinkedIn too.
Terrific. All right. Well, with Jen joining us and lots more guests coming up in just a few minutes, I hope that you keep watching us live here at the Oliver Wyman Health Innovation Summit. My name is Kate Warnock. Thank you for watching. Hi everyone, and welcome back to the GuideWell Insights Lounge. We're here on location at the Oliver Wyman Health Innovation Summit. My name is Kate Warnock, and I have a repeat guest to the Insights Lounge, Mr. Eric Grossman. Eric, welcome to the interview.
Thanks, Kate. Thanks for having me.
Happy to have you. We saw you last at AHIP, and now we're here in Chicago at the Oliver Wyman Summit. So Eric, you are the CEO of Next Health Technologies. You had so many great things to say at AHIP. I kind of wanted to go back and re-explore some of those topics. So Eric, in your role at Next Health Technologies, could you have predicted the exit of so many health plans from the ACA marketplace, and could these exits have been avoided?
You know, I think it's a great question. Hindsight's 2020, and it's easy to be a Monday morning, armchair quarterback.
Yeah.
But I think sort of is my answer. You know, I'm a big proponent of market forces versus public policy sort of driving the market, but we sort of had an untenable situation with all these uninsured Americans. But I think there were really two X factors that you kind of saw as sort of what may drive exit. And I think the first is public policy around the individual mandate. And unfortunately, it hasn't been strong enough to keep the healthy people in, to drive sort of the fundamentals of insurance, which is you got to have a balanced risk pool. So without that, health plans have been left with a lot of expensive risk. And that kind of comes to the second X factor, which is market forces. And unfortunately, a lot of these smaller health plans, in my opinion, sort of followed the bigger ones in terms of their pricing. And a lot of the bigger ones kind of came in with a low-cost, narrow network plan design. And unfortunately, because of the prior X factor, it created an environment with a lot of losses that little health plans couldn't sustain, so they had to exit. So in hindsight, those were X factors. We didn't know how they would play out, and it's led to a lot of shakeout. But as Obama says, I think there are things that we can improve upon and correct. Given that we have so many more people in the system, there's got to be some benefits there.
Right, absolutely. It's here to stay, isn't it? So, all right, well, let's take a look at Next Health Technologies and what you're pros at doing. So you give the consumer some nudges to help change behaviors. I was hoping you could kind of give us some scenarios where those nudges might take place.
Sure, and how they impact behavior.
For sure.
Sure. So the first thing that we do in driving consumer behavior change is find someone among millions of members who the analytics thinks that we can be successful at changing behaviors. A lot of people don't want to change, or they're too acute, they're too sick to change. So let's take out-of-network usage. So we talked about narrow networks. That's when you leave the health plan's network and get a higher deductible, higher copay, and a higher negotiated rate, which is not a good thing.
No.
But the majority of people, when they go out of network, they don't know they go out of network. And it could be thousands of dollars to any consumer or to a health plan. So the first thing is, let's take Sarah Gomez. We found her through the analytics. And she's a 25-year-old mother of two. She's lower income and lives in the city. And we found that she has no PCP, relatively little experience with the healthcare system, except she's taking her two children to the ER for avoidable reasons, and it's a freestanding ER and it's out of network.
Oh boy.
So that visit costs the healthcare system about $1,000, and up to her deductible, she pays all of it.
Right.
Okay. So we found her. She's impactable, right? Because she's going for a reason that we think is avoidable. She's going after hours. She's her kids. She works, and she's got kids, so we can all relate to that, right? So that's the who. The second thing we do is we got to communicate with her, and so Next Health reaches out to her via phone call. We get her on the phone after 5 p.m. and we educate her that for low acuity or flu or stomach ache, that hey, there's a freestanding urgent care center that's near your house that you can go to that will save you a lot of money. And Sarah's on the phone saying, well, I didn't even know I went out of network.
Right.
I haven't got the bill yet.
Right.
Or I didn't understand a bill. It says it's not a bill, so I didn't pay it. And we say, hey, can we send you, we know she has a cell phone, can we send you a cell phone wallet, the kind of thing you put on the back to put your credit card in,
Yeah.
that says, need help, text 2600 to this number, and it returns, 6 freestanding in-network, she doesn't really need to know that, accepting patients, urgent care centers within 5 miles of her phone. And it's at the point of need. It's not a phone
Right.
call, because we all forget. It's when your kids are sick. Like, what do I do? And it's either a refrigerator magnet, a cell phone wallet, something sticks on your phone, and then we send it to her, and we wait, and we measure the data. And then the third thing we do is we say, how well did it work? And we found for Sarah and hundreds of other Sarahs like her that campaign worked. And she used the SMS text vehicle the next time her kid had a stomach ache, and she went to the urgent care center, because we know we get the claims data. And then what ends up happening is we have machine learning algorithms that then say, hey, anytime a Sarah presents, we're going to send more Sarahs to that campaign that was carefully designed using what we call a nudge to get her to a more optimal care setting. In that situation, Sarah just saved, $900 net of the urgent care fee, and if she had met her deductible because she went twice, then the health plan, in your case GuideWell, would save $900 in claim savings, and you add that up over millions of members, it's a huge turn of the dial.
And really, it's as much as it's beneficial to the cost, the cost benefit of that approach. I imagine that the experience for Sarah Gomez and everyone like her is also far better, because she's getting, like you said, the help at the time that she needs it, and probably going to an urgent care setting versus an ER. Who wouldn't prefer to be in something that's going to be more efficient when you don't have that much time and a sick child?
Right. I mean, how many advertisements do you see at the airport or JTB Boulevard?
Right.
Advertising no wait time for the ER.
Right.
If that's all she sees and all she knows, that's what you're going to do.
Right. All right, well, let's take a little bit look down
Sure.
the road. Okay, so there's some other trends that might disrupt the health industry. And from your perspective, what are some of those things that you think can really help change the way we're doing business in the health industry today, be it blockchain or something else that might be on your radar?
Right. Well, I think blockchain is a good example of where sharing data in an open source, cloud-based environment has helped other industries like Bitcoin and others. And I think one of the presenters here, Chris Kay from Humana, talked about blockchain. But I don't think there's a silver bullet around, sort of sea change events. I do think that the sea change is large enough to drive major change in the industry, and I think I like the 3 C's. So the 3 C's are, the first one is cost. Well, obviously paying out $8 in claims cost every $1 in premium isn't viable for any health plan, regardless of your reserves. So that's led to the second C, which is compression. And you mentioned some of the sort of what's going on in the market with ACA. And then the last C is consequence, whether companies are going out of business or policy change in Washington. So I think those 3 C's breed innovation, and there's no better drive of innovation than desperation.
That's a good point. All right, one last question, maybe a little bit closer to home. Any other trends worth watching for exponential growth in the efficacy of prescriptive analytics?
So those were some big words, so I'll tackle those one at a time. I typically don't understand more than 3 syllables, but I'll take those. I would say that the biggest trend is the continued losses stemming from the Affordable Care Act is driving health plans and hospitals to absolutely focus on solutions that are presented at this conference that drive attributable medical cost savings and consumer behavior change. The word is attributable.
Right.
How do we know that when I reached into a screwdriver that it truly was my screwdriver that turned the screw? So that's attribution. And I frankly don't think health plan executives really care about the sausage machine. They need outcomes.
Right.
And it just so happens that prescriptive analytics, or what to do next, the what and the how well, and randomized control trials and machine learning are just absolutely no regret investments that you can make in the wake of all the market forces, all the headwind we're up against.
Excellent. Well, Eric, thank you for keeping it real here with us at the GuideWell Insights Lounge.
Right.
Always nice having you as a guest. My name is Kate Warnock. We're going to be up with another guest in just a moment. Please keep watching. Hi, everyone, and welcome back to the GuideWell Insights Lounge. My name is Kate Warnock, and we're here on location at the Oliver Wyman Health Innovation Summit. And I have a favorite guest joining us right now, Mr. Mark Stryker. Mark, welcome.
Hi, good to see you as always.
Always having a pleasure with you here. Mark is the Vice President of Business Development for GuideWell Connect. All right, so Mark, you are out on the front lines every day talking to health plans as we approach the open enrollment season. What are some of the things that you're hearing them talk about? What are some of the concerns they might have?
Sure. Well, it's a very, very dynamic time, and that's a bit of an understatement.
Yeah.
You know, there's a fair bit of turmoil in a lot of the markets across the country. You see it in the news headlines every day. A lot of it's driven by the under 65 individual businesses. So there are a lot of plans with a lot of real situations and problems that they need to solve, and so. You know, it's not as much as it has been in previous years about, okay, let's get more clients, let's get more members, let's get more customers. Now it's much more about, okay, how do we take this business and do the right things for the membership while at the same time making it profitable? And so, like I said, these are real concerns out there.
You know, and that touches on the theme that is kind of the overarching theme here at the Oliver Wyman Health Innovation Summit, which is the consumer imperative. And we just heard this morning some of the keynotes talking about why engagement makes business sense. So your clients are obviously asking, how do we make ourselves more relevant to our consumers? What are some of the ways that GuideWell Connect is able to deliver on those requests?
Well, it's let me go back to go forward a little bit, because you
Okay.
brought an interesting topic, because engagement is one of those terms out there that is, it's kind of like innovation in some ways, in that it is everywhere. It's a commonly used
Buzzword
term,
sort of thing, yeah.
a buzzword, but there is almost no collective and cohesive understanding of what it actually means. And so I think that is one of the biggest issues that the industry faces is, what does engagement mean? Is it just having a conversation with somebody? Or is it actually getting something done with somebody and for somebody? You know, we tend to think in GuideWell Connect, in our world, that it's a little bit more of a ladder. It's not just talking with somebody. It is actually working with them to have a positive outcome. Really down to the nuts and bolts of making sure they've got a good doctor, getting them to go to that doctor, making sure that they're in a good care program if they've got a condition. These are the key points of engagement that, to the point you just brought up, make business sense. Right. And it makes sense for the person. You know, this is where the opportunity for a win-win is there, to be able to work with a consumer to have a positive outcome that is positive for the health system as a whole. And so that's where we focus a lot of our time. You know, you had Eric Grossman on a few minutes ago. Eric's one of our partners. He's
right.
Forward-thinking organization. He's a great example. Blue Health Intelligence, BHI, that's another partner. Redpoint, another partner. And that's GuideWell Connect doing what you hear our enterprise CEO, Pat Garrity, talk about a lot, which is bringing people together to reimagine the future. And this is great, a great time to be doing those things. It's great partners to have, to take the best in clinical analytics out there, the big data equation around how do you find out what's important from a clinical perspective, and pair that with what we do, which is to take the consumer analytics and consumerism and use those two things together to have positive outcomes. And it's a big job, but it's a lot of fun.
You know, Mark, I remember talking with you even a couple years back about hyper-personalization.
Yes.
And, you know, again, maybe an early progenitor buzzword of engagement, but it seems to me like in this day and age, Connect has worked with those partners that really are making that hyper-personalization, you know, talking to the individual based on a wealth of knowledge about that person, you're able to nudge them, with Next Health Technologies, or deliver the right message at the right time,
Right.
so that you really are changing that behavior. And really, that's where the consumer does win. Who doesn't want to feel like they're supported and have the right
Yep.
tools available to them when they need it?
That's actually the key tenet of consumerism, right? There's a couple things, and my boss, Craig Thomas, talks a lot about this. Consumerism is the precept of different strokes for different folks. Different people like different things. Different people like to be communicated with in different ways. And so bringing that sensibility and understanding how to predict what that is when you're in a scenario where you've got a large consumer group that you may not have had direct interaction with before. That is absolutely key to be able to do this effectively. And as we go and now launch our formal member engagement service line, which is happening right now, it's one of the most important things that we've done as an organization, as GuideWell Connect. I think it's going to have the most long-ranging impacts for the organization and for our clients, most importantly, and for their members. And I think that is going to be one of the keys for how businesses come together in the health spectrum to make positive change in the future by doing it in concert and with the people that are the ones that we serve at the end of the day.
And Terry Stone, she opened this morning, Terry Stone with Oliver Wyman, she's a partner, and she's really putting on this event, gave her own personal anecdote about an experience with a sick child who, God forbid, got sick on a weekend when the doctor's office was closed, and just how, we have such a long way to go, but as you describe it, Mark, it seems like we really are putting the tools in place. We're making the right partnerships and collaborating with the right people to change that negative experience into a really positive encounter.
It's true, and there's so many things that go on out there about taking what's old and making it new again, because it's all the basics of the things that the consumer businesses have known for years about how to talk with people.
Right. All right, well, let's take a look ahead. What do you think is going to be happening in the next couple of years?
Yeah, so obviously there's we're probably a little bit more towards the beginning of the market turmoil than towards the end. Maybe we're in the middle. Who knows? But I think that there's probably still a ways to go to work some of that out.
We have an interesting political season that's
we
going
do,
to,
but at the end of the day, the things that we think about from a member engagement standpoint and understanding how to work with people in ways that they find the comfort in. That is going to transcend beyond just a single line of business, the Affordable Care Act or the under 65 or the over 65 or the group business. These things are applicable to every health consumer out there, which is everybody in the entire population.
Right.
So for us, we know that we're much closer to the beginning than we are to the end of that. So there's lots of work still to do, lots of work to do in carrying out the enterprise mission of helping people and communities achieve better health and convening folks to reimagine the future. So even for us in our specific niche on the member engagement side, there's so many people that we still need to bring together to move this forward quickly.
Right. Well, which is why you're here at the Oliver Wyman Health Innovation Summit. They do such a fantastic job of curating and cultivating the right kind of partners that we might see. Some different relationships that you can talk to us about next year.
Yeah, we will. And the hope is that as we continue to work with health plans out there, that the ones that are not where they need to be in some of these things, that they will get a little bit more proactive around saying, oh yeah, maybe we could use some help in this, because that's one of the first things.
Well, as Sam Glick, another Oliver Wyman partner convening the summit, said, we're beyond the table stakes is no longer going to cut it.
That's right.
It's all about appealing to the emotional sense and really getting people to change their behavior. So, Mark Stryker, always a delight to have you
Thank
here
you.
at the
Always great to be
GuideWell
here.
Insights Lounge. My name is Kate Warnock. We're going to be up with another guest in just a moment. Please keep watching. Hi everyone, welcome back. We're here at the GuideWell Insights Lounge at day one of the Oliver Wyman Health Innovation Summit. My name is Kate Warnock. I'm so pleased to bring back one of our favorite people from AHIP, Mr. Eugene Sion. How are you?
Thank you, Kate.
Eugene,
Great to be here.
we're glad to have you here. So Eugene, you are the founder, chairman, and CEO of Softheon.
Yes.
All right, well, to prepare for the interview for here at the summit, I took a look again at the interview we conducted at AHIP just in July, and you gave some really intriguing responses, and I kind of wanted to go back, dig a little bit deeper. So one of the things that you said is you predicted a supply chain transformation where health plans wouldn't necessarily own but govern their data assets. Can you give us a little bit more background on that vision?
Absolutely, absolutely. So our definition of supply chain, when we talk about, everybody talks about this consumerism. To me, supply chain and consumerism, it's almost like interchangeable to one another. Anytime you have a consumerism in a picture, you often engage in a series of partners or value-added resellers in a supply chain context altogether. I think a great example will be if that is the assumption that we make, if we just kind of look back to other industries. And probably no one is better example of a true supply chain manager is Apple. And today, Apple able to deliver million phones on the single day of their openings. Yeah? Yet, Apple doesn't probably owns a single factory. Okay, they are able to bring together series of vendors, including their competitors. Samsung makes most of the displays on iPhones, as you know, and there are so many other examples. Dell's always been. So when it gets to this just-in-time manufacturing, just-in-time consumerism, because individuals, consumers are looking for that real-time response. So what it really boils down to, how do I build those assets, if you will? Okay, in a safest and fastest manner, that without taking a lot of risks. So imagine if Apple had a factory and all of a sudden that a version of an iPhone was a flop, right? So in this new model, where the assets now being quickly assembled through globally, not just where you are now located, and now we're seeing the assets being expanded beyond the I will call the physical assets, but into the consultants. Into the research and development. So what we are seeing is is the value-added chain is being formed as part of a supply chain, and now being able to basically positioning yourself either on the supply side of the business, or it's going to be in the demand side of the business. Okay. I think what we see in the healthcare space, especially, for instance, demand side providers or service providers, Oscar will be a great example, because they are focusing on primarily the consumer. Where we see a lot of other health plans, good example perhaps is Centene, where they focus on the supply side of it because they extend and leverage their Medicaid assets and how they're able to bring an affordable insurance and sustainable business model to the consumers.
So I presume that this has all been enabled by technology, because I would presume that the reason why a health plan would own all of its data assets had something to do with regulation as well, and PHI and all of the laws that are there to protect it. So I imagine that we're now in an age where we've created a safer way of managing that data information, where it's not necessarily something that they have to keep under lock and key themselves.
That is absolutely correct too. If you look at it, over the years, last 15, 20 years, that the insurance carriers have accumulated a series of assets, some directly, some indirectly through mergers and acquisitions and everything else. And all of a sudden that you have this plethora of basically IT assets where the data is kind of all over the place. And there are so many entry and exit points of these systems altogether, it's very difficult. So I think converting your business model to a supply chain and basically piecemealing, if you will, a small portion of your business and pushing to a vendor downstream or upstream in the supply chain. And from this point on, so it is your now responsibility. And many of those vendors, because they're under contractual obligation through serviceable agreements and so on and so forth, they are building the systems from ground up with the idea of that the data protections, the privacy of the data, and so on and so forth. Case in point, Softheon, we are a small company, 150 engineers, primarily PhDs and whatnot. But we go through 5 different audits every year, from SOC 1 to SOC 2 to the PCI and everything else. As we speak right now, we have a red team attacking our servers, a company that we hired, and we have a blue team defending our servers. As we speak, this is an event that occurs on a daily basis at Softheon, and that's how we position ourselves to be a partner or a trusted, well-trusted partner in supply chain.
Well, you make a really compelling case for the vision that you have. So next question for you then, Eugene.
Sure.
You also said in our earlier interview that we're no longer in a winner-takes-all situation in the health industry. What drives your approach to collaboration, and how does this benefit the consumer?
Absolutely. So again, I think the what we see as an example, what's happening in the healthcare space, especially as it relates to the ACA, all throughout the day and all over Wyman, we had great panels, great conversations that all we are coming back to the same process altogether too. The healthcare is broken and that needs to be fixed. And if it was that easy, it would have been fixed by now.
Right.
Let's put it this way. So that's is our definition of not a winner-takes-all situation altogether. It needs a lot of help in terms of the consumerization, the marketing, the education. GuideWell Connect is a leader in that space. You're helping other health plans to better market, better reach out to the consumers altogether. We talked about the delivery systems altogether, the supply chain management, or middle office operations as we call it, and then you go back to the analytics aspect to it. How do I close the loop, if you will? So here's the one iteration, the first year of our exchanges. What have we learned? How does the consumer utilize our product and services? So what we are seeing is truly, it's no longer a mile wide, inch deep industry, healthcare. It's turning into really a series of pockets of inch-wide, mile-deep entities altogether that with the expert look into, let it be on the claims utilization side, how does it affect it? How does that particular population is using the product and services? So I can bring those experiences back to my product designs, give that to my actuarial so they can do a better product design and so on and so forth. So I think that in the typical supply chain, once again, giving back the same analogy earlier, probably Costco sells as much Apple devices as the Apple itself. So it's all about the ecosystem. That's one thing about it. And what makes this different than this time, this was a couple attempts, as we know, this is not the first attempt to fix the healthcare per se. I think as you just said, the linchpin of this thing is the technology. Technology is now so commoditized. It's no longer a differentiator. It's truly a commodity. Today, we just heard about, Sam Glick talking about starting up a business. You can go to Amazon, have 10 servers on your name in 20 minutes, right? You can just basically open up, go to crowdsourcing and raise some funds in 30 days from people that you never met, but they believe in the vision.
Right.
So that's our definition of that, basically ecosystem collaborations, kind of high tide, low tide. We all win or we all lose together. I'm hoping that we're all going to all win, including the consumer, which is the most stakeholder in the process.
Absolutely. Well, Eugene, you were referencing your engineers and your PhDs that work for you at Softheon. As I was researching, preparing for our interview, I came across a LinkedIn article that one of your engineers had put out, and it was all about blockchain and how it is applicable to the health industry, specifically health plans. I was hoping that you could kind of deconstruct for us, because we were just on with Mark Stryker and Eric Grossman talking about some buzzwords. Is blockchain a buzzword, or is it really something that you think can disrupt the health industry?
Right. Just like any new buzzword, it is a buzzword, and probably the blockchain was introduced to the general masses through Bitcoin, as you know, and has a close kind of association. But in reality, blockchain is just another algorithm, computer algorithm. Just like searching was an algorithm, how Yahoo did searches versus Google does searches altogether too. It is a way of doing things. And we have actually been using blockchain algorithms in many different ways, and not in the sense that how Bitcoin introduced blockchain to the masses altogether. One good example will be, for instance, if you had your last car buying experience, one of the things that I think that a lot of people do is they go to Carfax to see who owned the car, what they have done with that, how often it has been serviced. Well, that is actually the very rudimentary blockchain right in place for you. Okay,
right, great
so
example.
One distinction from that to the current model, instead of having a one monolithic owner, which is in this case Carfax, in the blockchain model, we're talking about millions of registries. So you are able to imagine kind of being on a Twitter and followers. You just post a message saying, who owned this car that I'm about to buy? and all of a sudden that information starts flowing downstream to you.
Okay.
So blockchain is a next iteration of big data. We discussed big data last time. So
did.
there is a close proximity, a close relationship. Here's where they are. What deems as a big data, we follow by 3 attributes. The volume of the data, immensity of the data, gigabytes, petabyte, now we're talking about zettabytes, right? Variety of the data coming in so many different ways. We see a lot of data coming XMLs and multimedias and all those things all together, and a lot of machine learning going to that space, as you know. And the velocity of the data, speed of the data, how quickly now we're generating. As we speak, there are Twitters are flying out of here. This is being multicasted on the internet altogether too. So if you think about the blockchain algorithm is an envelope that you can stuff into it. So it's a box. If you think about the same analogy, again, the FedEx analogy, is the supply chain distribution model. Think of the blockchains are the boxes that you can put something in it. And you can put anything. You have different sizes of the boxes all together too. So the blockchain is simply an algorithm that just goes around that enveloping the message and being able to share that message with anyone in a very simple terms, because I don't need to know the details. So that the understanding on opening up the envelope, seeing what's in it, will be left to the individual participating in it. But the registry is indicating that there is an envelope sitting at Kate's desk.
Right.
That is a blockchain registry, public registry, that anybody who wants to know how many letters envelopes sitting in Kate's desk, that's one thing. What do you pull out them? Which one of them are personal, which one are business? Those are be determined by the individual applications like Bitcoin. So it's an overall big thinking process altogether. It's really the next step to the big data. It's about collaborating and sharing big data in a very unified way for an application-specific way altogether. So some of the areas like we talk about a blockchain use is the use of most common one, for instance, is a medical record. So rather than, as you know, that we went through this major exercise around health information exchanges and there was supposed to be a one place we can go find all my medical records. Well, that did not happen in reality. Ended up creating multiple silos. So we hope that the owners of those silos, the governors of the silos, will adapt to and agree on some collaboration mechanism that you as an individual, I as an individual, I can say, show me all my medical records. All of a sudden that information starts flowing down to me, but I am the one that actually, that key that unlocks every one of the data altogether. And then I can give that key to my doctor while I'm visiting in his office, in her office. As soon as he or she updates my records, I get that key and walk away. I see my next doctor. So my records follow me in the process. That will be an application of a blockchain algorithm how it's being used, and similar in the different areas as well too.
Well, I mean, it sounds like the holy grail of what we've really been looking for. It seems like does away with the interoperability problems that
Yes.
we've been plagued by, the siloing of information.
Yes.
Most importantly, though, it puts that control, as you said, back in the consumer's hands, and that's something that has been a challenge and a real demand for some time.
Yes.
So I'm so grateful that you explained it to us in such clear terms, and was really looking forward to covering that topic. So no doubt we're going to touch on that again with you the next time we have you back, Eugene.
Look forward to it.
At the GuideWell Insights Lounge. So thank you so much for joining us.
Thank you.
My name is Kate Warnock. We're going to be up next with our next guest in just a moment. Please stay tuned. Thank you. Hi, everyone, and welcome back to the GuideWell Insights Lounge. My name is Kate Warnock, and we're here live on location at the Oliver Wyman Health Innovation Summit. My next guest is John Urbanek. John, welcome to the interview.
Thank you.
John, you are the Senior Vice President of Health Insurance Markets for Florida Blue. So Florida Blue, John, has been in the media for all the right reasons. As we see many competitors leave the marketplace, the ACA marketplace, Florida Blue has really maintained a commitment to staying within the state of Florida, and I understand in all 67 counties of the state, no less. What is it that's made the difference for your plan where others have not been successful?
Well, I think first of all, the difference is that we have made the commitment. Florida's our only market, and in order for us to achieve our mission and to be successful, we know that we had to be relevant in all of our market segments. So, when we planned for the ACA, we said we didn't want to just survive, we wanted to thrive. And so that meant making a commitment to all 67 counties. It meant that we really had to think long term. And other things we have to understand is, first, health environment in Florida changes every day. And so even though we have that long-term approach, we have to be flexible and we have to stay on top of those changes and adapt to them as they go. And that's been really important for us. We also have to understand that getting the membership's no longer enough. When you're talking about consumer markets, they're very volatile. And so we've really got to manage the business very differently than we've done it before. And I'd say a great example of that is how we designed our primary exchange product, MyBlue. And we started with a clean sheet of paper. We said, what are the customer needs that we're trying to address? And what's the price point that we need to hit? And we use that to drive the product design. And as we move forward, what we're looking to do is each year, we have to ask those same questions. And we have to change our company to meet those needs and achieve those price points. And that's how we're going to keep pace with this really important market for us.
Well, no doubt that's why you're here at the summit, because I know that one of the overarching themes is the consumer imperative and how it's going to transform the health industry from the outside in. So I guess by you designing this model, not from a preconceived notion of what the plan needs, you really mirror what Sam Glick said this morning. Sam was talking about, it's not just about delivering on table stakes. You really have to start with the consumer and build backwards. So that's the approach that you took.
Absolutely.
Yeah, and it's working.
So far, so good.
It's working. All right. Well, another thing that's notable about Florida Blue is a very significant retail presence. You actually have a retail model, and if I understand correctly, it was one of the first plans in the nation to have that. Mm-hmm. How has that been a differentiator for you, and how do you think that you're going to iterate on that retail model?
Well, first of all, you have to understand that back in 2007, when we were first coming up with the retail design, individual policyholders were a small percentage of our business. But at the same time, we knew that individual decision making was going to be really important as we move forward. So initially, we designed a concept that said, let's help people make better decisions. Let's also put this in a very convenient setting for them. So convenience and support was that first piece. You fast forward 10 years, the individual business, under 65, Medicare, Medicaid, that's now half of our business. And the retail centers, we now have 20 of them in the state. They're fixtures in their community. They've moved that scope from that initial piece to now health navigation, health coaching, wellness resources, even clinical services. So we've done a lot to really help meet the market needs. But those markets I talked about, the individual markets, those are our growth markets. They're going to continue to be a significant part of what we do. And so we've got to ask ourselves, where do you go from here? And so as I think about the next generation of what we want from retail, I'd say there's three components. So the first one is we've got to continue to find new ways to help people identify and achieve their health goals. When you think about what's happening, healthcare is becoming more and more complicated. Every day there's new treatments, there's new medications, there's new innovations, and people need help navigating all those pieces. And we can be that advisor that really helps put that together for a person, helps them understand where they need to go and how to get there. I think the second concept is we need to become a health destination. So we've become a great point solution. People come to our stores when they want something. We want them to come and hang out. We want to have the really cool things that are out there that help people participate in their health, really take charge, really learn how to take control. Because when you do that, you become part of their lives. You build loyalty, and really you can have a great relationship that way. I think the third piece is, as we continue to grow in this market and become more relevant, we're going to have to look at where the centers are and look at the footprint that we have for the centers and make sure that we're putting centers where our customers are so that they can be part of that community and really make an impact there. If we do that, we build trust, we build value, and it's going to really help us move forward successfully.
And I imagine that face-to-face encounter helps the health plan really better know the consumer too. So you're getting that intel to continuously iterate and evolve those products and the services that you offer because you see that customer every day, don't you?
Yeah, well, that's what consumerism's about.
Yeah.
It's making that connection, and people make it different ways. And this face-to-face channel is one that people love. We've got mid 90% satisfaction rate with people who go there, and that's very powerful.
And again, builds that loyalty and that trust. All right, next question for you then, John. Consumer engagement is a top theme being explored here at the summit. What are some ways you've been able to engage members in a state as diverse as Florida? You open by saying healthcare in Florida changes every day.
Yeah.
How do you continue to keep up with those demands and when your population itself is changing its demographics so routinely?
I really feel like our industry has not even scratched the surface on this is a huge opportunity. But at the same time, you have to think of where we've been. So when the ACA first started, there were 2 million people coming into the marketplace. Many of them had never had health insurance before. Some of them didn't even know what health insurance was. So our initial efforts were really out there making the connection, talking to people about what this is, why you need it, and really trying to build that trust. And we knew that that was going to be a huge lift, face-to-face, grassroots, really a very different market approach than we've ever had to take. So in each of the first couple years of the ACA, we did over 3,000 town hall meetings, just connecting with people and having the conversation. And so I would call that a primitive way of engaging. We're looking at more digital type opportunities moving forward. But that way, when we did it, was very successful. I mean, arguably, we are the largest exchange player in the nation. But now that we have that membership, we have to keep them. And if our only interactions with those folks is they enroll, we pay their claims, they get a bill, and we get a renewal letter, we're going to lose them. And so we've got to, again, look at how we bring that value back to them. And if the value is that we're helping them improve their health, then we've got to talk about on a daily basis, how do we support that? And it's really going to be getting them the right messages at the right time in the way that they want to do it. And some people want to be on the phone, some people want to be online, some people want to be in our retail centers. We've got to look at that. And we actually have the market data to tell us that. So we're starting to build campaigns around those pieces and starting to make those connections. And we've made small wins this year. In the Medicare side, we've been able to use those campaigns to help improve participation in various screenings and things like that. But we need to expand that. We need to put that through all of our business. And when you think about how complex that can be, it's a very heavy lift for us. It's a huge digital platform that we need to look at, but we need to accompany that with a very different human platform, because you need to have the culture where every employee feels like they need to know where our members are in that journey and they need to support that. And if we can do that, it's huge. That's a big lift, it's a big investment, but even little progress in that area makes a big difference for us. So that's something that we're going to continue to push moving forward.
Well, you know, I want to highlight something that you mentioned in your response, but I think it's worth repeating. You know, you said that the Florida Blue Plan is one of the largest exchange players in the nation, and you only operate in a single state.
Right.
So I think that circles back to the first question, is the commitment to Floridians and the knowledge that you have gleaned, you know, and you continue to evolve how you do business, and be that through technology or something as simple as a grassroots face-to-face meeting. You've clearly figured out some of the consumerism approaches that work.
Mm-hmm.
Yeah.
Well, the main piece is putting the customer first and really saying what are those needs and driving us to change to meet those needs.
Right. Well, John, it's been a delight talking with you. Thank you so much for joining us here.
Thank you, Kate. It's been a pleasure.
All right. My name is Kate Warnock. We're going to be up with another guest in just a moment. Please keep watching. And we're back live here at the GuideWell Insights Lounge here at the Oliver Wyman Health Innovation Summit. Hi everyone, this is Kate Warnock, and I have such a distinguished guest joining us, Dr. Marty Makary. Dr. Makary, welcome.
Good to be with you, Kate.
We're happy to have you. We saw you a couple years ago at the first Oliver Wyman Health Innovation Summit that we did, so it's a delight to have you back.
Great to be back.
All right, so Dr. Makary, you are the Professor of Surgery and Health Policy and Management at Johns Hopkins University School of Medicine. Dr. Makary, you're going to be discussing creating change through human behavior. Your panel, is that later today or is it tomorrow?
Yeah, this afternoon.
This afternoon? Oh, that's right, just in a few minutes actually.
Yep.
How has your expertise on patient safety informed this talk, and will we hear any surprises?
Well, you know, my research team often says, where do you get research ideas from? And I tell them that by practicing medicine and being on the front lines, there are so many systems that can be better designed that you get ideas just from practicing. And you know, when I get involved in research, oftentimes the patients keep me grounded. They'll ask me questions like what to expect after surgery. And I might go into the litany of complications, statistically citing the odds of those complications happening. But the reality is sometimes they'll cut me off and say, whoa, doc, look, I just want to know, when can I mow the lawn again? Or when can I hold my granddaughter?
Right.
And those are the things that remind us that what's important are patient-centered outcomes when we talk about quality and safety in healthcare. You know, I had a patient recently ask, what are the odds that I would develop pancreatic cancer in my lifetime? And you know, we never think of things like that. We think of the incidence rate as 38,000 deaths per year. We think of the increased risk with different risk factors. but I've never thought about what are the chances that somebody without any risk factors will just develop cancer at some point in their lifetime. And I asked all the other colleagues that I have, what are the odds? And they would cite the incidence rate, the death fatality. But I said, no, the question that he's asking is, what are the odds? The odds are 1 in 67. We don't tend to think of things in science from that patient perspective.
Right. And I think what you shared with us is it's the consumer imperative. It's the overarching theme for the Health Innovation Summit. And obviously you're interacting with patients every single day. So as you said, they keep you grounded and probably challenge you to think in different ways. So, all right, Dr. McCary, our next question for you then. Is there parallel here? Some health enterprises hope to, quote, delight their customer in new ways before they've perfected the basics of their business. Can the same be said of health practitioners and new medical technology?
Well, at this conference, there are a lot of healthcare startup companies, and they want to address a pain in society, an obstacle that patients have, a barrier to quality healthcare. And to be honest with you, the hunger for some innovation outpaces the maturity of the quality data. And what we have sometimes is this desire to try to navigate patients and give them the tools to navigate their care. But the reality is we just don't have those metrics. They're not that mature yet. We don't want to simply direct people to the doctors with the lowest mortality rate because they may be the doctors that are taking care of the most low-risk patients. Maybe, so there are all these issues of risk adjustment. And in general, in the field of innovation in healthcare, i.e. startups and patient navigation tools, the hunger for some fresh new idea and for some way to help navigate patients using good data has outpaced our ability to produce data with good, solid, mature quality metrics that are endorsed by doctors and that doctors can rally around. So that's been the challenge in healthcare. And oftentimes we'll ask, what do we do with statistical outliers in healthcare? And if you ask non-doctors, they'll say, well, we got to put them in jail and we got to hunt them down and we got to get them out of the system. If you ask doctors, they know that most of us, by and large, the vast majority of people that go to med school go in with great intentions, and the response from doctors about outliers is we need to have a one-on-one sit-down. We need to address the outliers. We need to instruct them, guide them, help them. And it's a whole different approach to quality in healthcare.
Very good. Well, interesting too, your perspective. I always enjoy hearing it. All right, another question for you then, Dr. McCary. Transparency in care delivery has led you to pioneer the adoption of common sense solutions, like letting patients see their doctor's notes in real time. I saw that published recently. I think on your Facebook page you were talking about that. And lifting visiting hour restrictions so that families can be more involved. How do you scale these solutions across the industry?
Well, I think increasingly hospitals are asking, can you give us a toolkit to improve quality and safety? And we're saying, hey, look at the great ideas out there. Doctors have great homegrown ideas all across America, and a lot of times we just need to listen to them. For example, we just built a new hospital at one of our affiliates. It's a wholly owned Johns Hopkins hospital called Sibley Memorial Hospital right in Georgetown in Washington, D.C. We don't have steps into the bathroom or the shower or from the bed. Why? Because falls are a big problem.
Sure.
We have night lights. This is a brand new hospital with state-of-the-art technology catering to patient safety and trying to ask, how can we design healthcare better so it's smart, so we can reduce hazards, so we can have nurses in close range based on where they sit? How can we design the rooms and the floors and the whiteboards to write down all the information a patient needs to know so they can ask the right questions and be informed? And this is sort of the fun part about healthcare right now. People are hungry for fresh new ideas. And I think we're seeing that all across America. And it's a really exciting time.
Well, how exciting, too, that you can tap right into your own best ideas right in your own hospital setting amongst your employees, the people that work with their patients every single day that have these simple breakthroughs that can really make an extraordinary difference, like removing a step into a shower.
And people sometimes think, oh, it's neat that you invented the surgery checklist, or, I didn't invent the concept of a checklist. As a matter of fact, industries all over have been using them for centuries. But what we do is we put out there a lot of different ideas. We throw a lot of spaghetti against the wall, and we ask doctors, do you find this helpful? Do you find this helpful in achieving better outcomes? Do you find this good for safety? Do you believe, without any scientific analysis, we'll ask them, do you believe that this makes care safer? And when the docs are telling you, when the voice of frontline docs are telling you, yeah, this makes sense, this is going to prevent those rare events, we realize, look, we can listen to doctors and not wait for the giant randomized controlled trials that'll never capture rare events in a short period of time to measure innovation. So I think we need to get away from the idea that we have to have a randomized controlled trial to evaluate whether or not something is good for patients, because the reality is we'll be paralyzed for years with inadequate funding and inadequate feasibility in doing these trials. And just ask the doctors, look, do you think this is good for patients? And ask patients, do you think this is something you would find helpful? And that's the cool thing about the startup and innovation community right now in healthcare. It is a quick-moving, fresh new idea culture. And I think, when we look at the stuff we've done, the surgery checklist, the work against bloodstream infections, measuring safety culture with a safety attitudes questionnaire. We didn't develop the Open Notes program, but we certainly advocated for it. All of these great new ideas that are out there were all things that we basically put in front of frontline docs and asked them, do you think this is helpful?
And I would think too that that's helping to address that burnout rate. We're hearing more and more the physicians, the clinicians who are practicing and feeling like they're not able to practice the medicine that they went to school, what first inspired them to help people, because they're bogged down with bureaucracy and other things. So here you're giving them an outlet and really helping them be engaged in an outcome that's far beyond just their immediate practice. So I think that's another benefit, isn't it?
Yes, absolutely. They want to be, docs want to be part of the solution. The safety crisis is a big problem. The medical care gone wrong is the third leading cause of death in the United States. And docs are getting crushed out there. First of all, they're getting unfairly blamed for a lot of the problems. They're getting hit with lowering reimbursements, higher costs, higher overhead costs, lowering payments from Medicare and payers, increasing malpractice premiums, and now all these regulatory requirements. Docs are getting crushed out there. And they're starting to say, look, do we have to put up with this? And we're seeing a revolt, almost a revolution in the medical community among doctors. You're seeing this in primary care with concierge medicine. They're saying, heck with all the paperwork, regulatory stuff, we're just going to practice medicine the way we've always dreamed we've wanted to practice it. We'll make house calls.
Yeah.
You can have our phone number. You pay a standard subscription fee. And this is what concierge medicine is doing. And they're saying, heck with all the traditional healthcare system stuff that we had to do, and instead of being forced to see 5 patients in an hour, you have my unlimited attention, and we'll do a full, in-depth, preventive screening, proactive, dietary, lifestyle, good primary healthcare visit. And that's sort of the relationship that a lot of these docs have been craving. The concern we have, of course, in health policy is, are we creating a 2-tiered system? The reality is that's a global trend. That goes on everywhere. There's a private and a public system in every country in the world. Unfortunately, we're getting there via a doctor revolt against all the regulatory and other reasons that doctors are getting crushed right now.
Well, so to your point, Dr. McCarty, hopefully this is where there's such a tremendous opportunity for pain points like that. What's forcing that revolution that you said, that maybe there's a way to tap into a solution that more people can benefit from, that it's not necessarily going to create a healthcare disparity in our population. So, and one final question for you, because I know you need to get going for your panel. All right, you are active on social media, and I love that. In the 2 years since we've last spoken to you, your Twitter following is gigantic. Do you feel that using social media has made you more transparent to your total combined? You've got 43,000 followers, and it's true, 43,000. And do you advise more health executives to make the move to social?
Well, I think social media is great, and I think one of the reasons people have rallied around some of the messages of our research and writing and advocacy work at Johns Hopkins is that we're concerned. We're concerned about the trends in healthcare. We're concerned about the fact that the doctor burnout rate is as high as it's ever been.
Sure.
We're concerned about corporate medicine and hospital monopolies. We're concerned about the whole sort of back system of the grid. If you think of the energy industry, energy is produced and it's used, but there's an entire grid where energy is bought and sold. And we had the doctor and the patient, but now we have a grid behind us of a gigantic industry where our services are being bought and sold and discounted and marked up. And we're starting to say, hey, wait a minute, can we streamline healthcare to make it more efficient? Because to be honest with you, this is just as the patient advocate side of doctors. Our patients are complaining to us. They're telling us, hey, I can't afford this. My premium is crushing me. Half of America makes $42,000 or less in income. The average mean income in America is $42,000. When your deductible is $10,500 for a family, as it is on the bronze plans on the exchange, that's the average deductible for a household, people are getting crushed out there, and we as docs need to be advocates for our patients.
Understandably. Well, Dr. Mercari, I know that you're going to have a fascinating conversation with the panel that you're going to be leading in just a little while. So thank you for taking the time to join us here at the GuideWell Insights Lounge. My name is Kate Warnock. We're going to be up with another guest in just a moment. Please keep watching. And welcome back to the GuideWell Insights Lounge. My name is Kate Warnock, and we're here at the Oliver Wyman Health Innovation Summit. Delighted to bring our next guest, John Kao. John, welcome to the interview.
Thanks, Kate.
John is the president and CEO of Alignment Healthcare. So happy to have you. I know that we have a relationship through GuideWell with Alignment. So, John, your presentation tomorrow addresses how to really achieve population health. What are some of the points you're going to make?
Kate, the whole foundation for us is population health through collaboration, one person at a time. And so we fundamentally believe that having assimilation with hospital partners, assimilation with payer partners like Florida Blue, all working together with one common goal, which is taking care of seniors, saving lives, and improving health. And we're going to talk about how to actually do that with the core capabilities we think are important to accomplish that. One of which is going to be taking lots of data, big data, turning it into smart data, embedding that into clinical interventions that lead to better outcomes. So we'll be talking a lot about that.
You know, I think one thing that's so fascinating about your model is that you have a very high tech but also high touch model where you even have sensors in the home, and it's all meant to really help that frail elderly lead a more a happier, more productive life. So I wondered if you wanted to talk a little bit about that.
Absolutely. I mean, there are 50 million seniors in this country. 50 million. Approximately 20% of that population you would characterize as having a frail or polychronic condition. That's 10 million people in this country. That population really, we believe, is underserved from a care coordination perspective. They are sick, and we think that what we do with delivery systems, with payers, actually helps save lives and improve health. And in many respects, the whole mission of the company is serving that group of people, because they need it the most.
Right. Well, that leads me to my next question. In reviewing some of the material to prepare for this interview, John, I was so fascinated to hear that you quoted that your innovative model is constantly learning. What are some of the ways that your model has improved on itself?
I got to tell you, it's a philosophy of clinical innovation.
Okay.
And the most recent evidence of that is what we call our command center. Every day, for every member, we get real-time data. We get pharmacy data, lab data, encounter information. We get authorization information. We get all the information we can real time every day for that member. And so what happens is we can deliver the right care for the right patient in the right place at the right time. So every single day, every single minute, we have clinical people almost serving as an angel on our members' shoulders, looking out after them.
Right.
And so that process of just continuous improvement and continuous tracking of information for the benefit of our members, I think differentiates us in the market, which is why we're so important to work with the doctors and the hospital partners that deliver the care.
So you're lifting, by your efforts, you're lifting everybody in the health industry to be able to really keep that consumer right in the middle, which is what this whole summit is about.
You couldn't have said it better, Kate. I mean, we think we have the best hospitals in the world. We think we have the best doctors in the world. We have the best technology, the best carriers in the world. And so what we want to do is we want to assimilate into the delivery system and collaborate with them and the payers for the benefit of the consumer.
Okay, well, John, if that's such a hopeful and such a progressive idea through collaboration, we know obviously that there are still so many barriers that exist within the health industry from us to really be able to address the holistic needs, especially of this frail elderly population that Wyman addresses. So what are some of the ways that, some of the barriers that you think are still exist that help us, prevent us from delivering that kind of care?
It's time and training. And to give you an example, at the end of the day, the physicians, the practices have to transform. The physicians need to believe that this model of care coordination for the senior is good medicine. And it's working. For example, in our North Carolina operations, we had several hundred of our members with remote monitoring tools that yielded zero readmissions on that population. And so the clinical outcomes are working for the patient. But it takes that kind of outcome for the doctor in the practices to say, wow, this is actually producing good outcomes. And then when you align the economic incentives properly, which we do, with the support of the delivery system and the payer, the doctors get on board. And that when the doctors get on board, things start changing. And so, for example, in all the markets we serve, we have community-based physicians, and they pretty much understand it and get it. We also have physicians that are primary care physicians that are employed by health systems. And so we've worked very, very closely with the doctors and the health system leadership to make sure the incentives or the compensation models that people refer to as work RVU models are amended in a way consistent with what the systems like, but incentivize these doctors to work within the system.
Right.
So these are learnings that take time to implement.
Right.
But at the end of the day, it's clinical outcomes. The doctors respect the clinical outcomes are improved, then they get on board.
All right, well, excellent, and what a fascinating role for you to be in as you evolve in this space for some of our health consumers who are most in need. So glad that you were able to join us here today. John, my name is Kate Warnock. Thank you for watching. We're going to be up next with another guest soon. Please keep watching.
Thanks, Kate.
And we're back live here at the Oliver Wyman Health Innovation Summit. Hi everyone, my name is Kate Warnock, and we're here at the GuideWell Insights Lounge with our next guest. This is Dr. Griffin Myers. Dr. Myers, welcome to the interview.
Sure, thanks for having me.
We're happy to have you. You are the founder and Chief Medical Officer for Oak Street Health. So Griffin, in reviewing your company, you seem to have cracked the code on providing affordable, patient-centric care to low-income seniors. Tell us more about Oak Street Health's business model.
Sure. The way you phrased that question suggested I did it, but I would give credit to a team who provides that care. for us, a traditional model is a fee-for-service model, and my suspicion is if folks are watching this, they know what that means, but it's the way the rest of the economy works. Physician does service, patient pays fee, and it creates a strange incentive to want to do more services, regardless of the value of those services. And so for us, we saw a problem from a bunch of different angles, particularly for low-income older adults. I'm an emergency physician by training, so my experience of that was seeing the same people over and over again in the hospital, not for acute conditions, but for exacerbations in chronic disease. And so that means that the reason that they're there is not because they want to be there, it's because we don't have a structure in place to provide that level of support. So what we decided to do was try to build a model where we could invest in primary care, keep people well. We say happy, healthy, and out of the hospital. And because hospitalizations are so frequent and so expensive in the low-income population, we can keep people out of the hospital, not have to spend that money, and capture those savings and invest them back in the model. This is what we call a value-based model. There's a bunch of different terms for it, but our business model is really just that. We work in neighborhoods where there are lots of older adults, typically of low income, typically with lots of chronic disease. They don't often have great access to primary care, and so they get most of their services in a reactionary way in the hospital. We build and operate physical clinics with physical doctors and nurses and great teams that take care of people. So this is not an app on the App Store. It is a network of primary care clinics with the greatest folks that I've ever worked with who invest their time and energy in prevention. And what we've seen is we've been able to move the needle not a little but a lot in keeping people out of the hospital. That creates the savings, and that's the wheel as it turns. Keep people out of the hospital, create those savings, capture those savings, invest them in better primary care, reduce more hospitalizations, and that's how it works.
Got it. Well, here at the summit, we had attendees were able to take an immersion tour, and your Oak Street centers were part of, or clinics were part of that tour. What were some of the feedback that you got from the attendees here?
Yeah, so lots of emails since, lots of folks in the moment giving us feedback. I think there are three things when you're in the space that makes it different. Number one, it's a community-based practice. Number two, it's team-based. And number three, it's really patient-centered, and I can talk about what those three things mean. Community-based means we're not in a hospital. We're in a neighborhood community practice. The Bronzeville Clinic where we were used to be a grocery store. It had been empty for 10 years, but it's in that community. And then also we, in addition to being neighborhood-based, the first third of the building is a community center. If you walk into our clinic, many people don't know that you're in a clinic because that space is a community center, meaning it's open to the community, and there are events all day long, every day, and some of them are serious events, having a urologist come give a talk on prostate cancer screening for men in the neighborhood. Others are fun events like speed dating for seniors and bingo. But what that is, and there are people who are there every day, and it's become their place to go. And instead of going to the McDonald's on Cottage Grove, they go hang out in the Oak Street Clinic. And what that does is lower the bar and the fear associated with going to the doctor, and makes it very community-based. The second thing I said is team-based. And when you come into the clinic, again, it is a big open space, and there's nowhere to hide. People often say two things. Number one, it looks more like an emergency department than a clinic, and that's not my influence. That's because you want those open spaces where people can collaborate and move around as a team. The other thing is when physicians come visit, they often ask, where's the physician's office? And we don't do that. We have some semi-private charting area, but again, what we wanted to do was encourage team-based care, and we still have an incredible amount of respect culturally for our physicians and our providers and the skill that they have. But we don't have a protected space where they can hide, because you want teams to be able to move around with each other. And then the last thing is patient-centered, and I think a lot of people say that's one of my favorite buzzwords because it ultimately is meaningless if you say it enough, but we seriously try to make patients' problems our problems, and it's harder on our teams. I believe very seriously that being a provider at Oak Street is harder than elsewhere because we've assumed a lot of what is typically layered on for the patient to solve to ourselves, and it's incredibly rewarding, but it just speaks to the quality of our teams.
Absolutely. So a couple things. as you were going through those three different responses, I strongly encourage anybody to visit your website because you have patient testimonials that are just, boy, if they don't sell it, I don't know what would. And that's one thing. Another is the calendar of events. So as you said, it's a community center, and so there might be a knitting class, there could be a dance, there could be a movie night, that sort of thing. So I love seeing that. But I also wonder, as far as hiring those physicians who are maybe used to a more traditional setting, is it a challenge, or are you finding people that are really, this is so resonating with them that they're coming to you?
So that's a good question. And I will tell you, when we started, I did not anticipate this to be a challenge, but you hear a lot, there's a shortage of primary care doctors, and that because of that fee-for-service milieu, that you've had people deviate away from primary care into other specialties. What I would say is that we have an elite team, a very diverse team in very many ways, but the one thing they have in common is they believe in this mission. And the exciting thing for me here is that we have, it is probably the second most humbling part of this work. The first most humbling is that our patients trust us with their care. The second most humbling is that these physicians and nurse practitioners who provide care and lead our care teams, many of whom are way smarter than I am, have trusted us and this model as a place for their practice. It did initially, was very hard to attract elite talent. Now, as we've developed a reputation for being the place where you're going to get very, very sick, but lovely and incredibly deserving people who you get to provide care for, that has been a big selling point. The fact that because of this value-based model, we invest time and energy and resources not in getting a CPT code, but in getting a health outcome at the end, and that the docs have visibility into what that is. I mean, I think the thing for me, and my founding colleagues tell me often not to say this, but my biggest complaints, I miss that opportunity to be at the bedside with patients, and that's something that. I see that joy come back in the work that our providers do. And I do not want to say that it's easy. Like I already admitted, I think it's harder. And they have hard patients to work with. And it's way bigger than just making medical decisions because there's social context and cultural context and poverty and disparities. But by doing the incredible work they do, that's what we address. And so again, I get to say the words here, they do the work.
Well, I think there's a reason why you were a tour for the summit. As Terry Stone opened the summit this morning, and she was talking about her own consumer experience, but really kind of addressing all the challenges that we face in the health industry. It includes those things that Oak Street Health is really tackling. It's the social determinants of health, it's the care teams, it's the time and the attention that we really want to put on the consumer as the center of our care delivery. So kudos to you for being highlighted
to the
that
team,
way.
yeah, for sure.
Yes, for sure. One final question for you, Griffin. What has you most excited about how the health industry is transforming from the outside in?
I cheated, obviously, because I saw a couple of these questions. I will tell you, I don't read it as an outside in. I very much feel like this is an inside out. And I don't say that to be provocative, but I'm a doc who went to medical school to address the things we talked about, and you see these challenges, and our team is a team of really experienced folks who love our patients and love our mission. I think the hard part is that fee-for-service is something we've done for 50 years, and it's created some bizarre incentives. And what this value-based model lets you do is take that step back, and the best solution to this, I think, will come. I think where outside in helps is that give credit to CMS and some of the others who are trying to lead the way and where this is going to happen. And so that's the outside in. But I see this not only as better for patients, but far better for providers. And it's going to be bumpy. It's going to be bumpy as we get used to getting paid differently, to focusing on different things, to learning to do reporting. Working in teams is hard if you've not done it before. But I think those are all great things. And we're going to look back on this after we've made this transition and see patients get far better care. They spend far less money. They have a far better experience. Practitioners feel like they have their practice back, that they're focusing on the right things. And that, to me, is so... I don't want to turn your question entirely. I think we've had great leadership on the outside-in perspective, but I also think this is fun because it returns sort of the point of the game to the people on the inside, the folks who take care of patients, and to patients themselves.
Congratulations to you, Griffin, for really being at the leading edge of this new way of delivering care, and many ways it harkened back to the old ways of delivering care, but you're finding a way to make it work financially and at scale. So wonderful having you here. Thank you so much for your time. My name is Kate Warnock. Stay with us. We're going to be up with another guest in just a moment. Hi everyone, and welcome back to the GuideWell Insights Lounge. My name is Kate Warnock, and we are here at the Oliver Wyman Health Innovation Summit with such a distinguished guest. We bring with us right now Donato Tramuto. Donato, welcome to the interview.
Thank you very much, Kate. It's a pleasure to be here.
We're happy to have you. Donato is the CEO of Healthways. First question for you, Donato. You're presenting on the topic, Across the Great Divide, Partnering for Healthy Communities. What are the main points you'll share?
Yeah, so I think there are three main points. I think in order to really move forward the needle, and I believe right now healthcare is not in a transformative state, it's in a turnaround state. And what I mean by that is that you have to still transact, and you still have to address the challenges that you have every day, and then you have to have that leadership capacity to transform it. And so what we were talking about here today is what I think are three significant elements. I'm about ready to release my book next month, and I highlight these three elements: that you must have collaborative IQ. The higher our collaborative IQ, the ability to want to work with one another and not get so caught up with what you have invented, get more caught up with the commitment we all have for social change. The second element is that it's no longer about innovation, it's about integration. We have more than 50,000 healthcare apps out there. Less than 5% are actually used. What that tells me is that innovators innovate for whom what they know. We as healthcare leaders have to look at the best and be willing to integrate for the sake of moving forward that needle for healthier communities. And last but not least, we have to have what I call social compassionate leadership. I think you can lead and be successful in your business. I've been in business for 37 years. I've started several companies. I now run a publicly traded company. We have been able to meet the shareholders' expectations. If anyone doubts that, look at the stock. However, it's more than that. People don't care what you do until they know why you do it. And I think we as healthcare leaders have that opportunity. And so I have given a number of examples of how we have implemented those three very critical elements. That's collaborative IQ, how to integrate, don't just innovate, and how to really have compassionate leadership. I've given three different examples today of how we have demonstrated that in the last number of years. And so that's really what the talk was about today.
Well, and it's so exciting to hear you use those words. Alexandra Drain is going to be on our here as a guest at our lounge in just a little while, and she was moderating a panel this morning, and she opened by saying, "I feel like I'm among my people when I hear words like kindness and empathy and compassion being used at a health industry conference." And so Oliver Wyman has clearly, it's tapped into a movement, hasn't it?
Absolutely, and it's very, very interesting. My book's title is called Life's Bulldozer Moments, How Adversity Can Lead to Success in Life and Business. And a number of months ago, I was a keynote speaker at a conference, and I really didn't want to talk about this book because I didn't think or believe that leaders were ready for it. And so the moderator convinced me to give the talk, and afterwards, I was touched by how many people, my story is just a story. It's no better, no worse than anybody else's story. But you have to be bulldozed. You have to have a moment in your life where you have had a healthcare challenge or you've had some difficulty. For me, I lost my hearing at age 8. During the course of 6-7 operations, my sister-in-law died in childbirth as a result of a medication error. And so that made me a more compassionate leader that, yes, I've had a successful healthcare career. I'm very fortunate from a business perspective. But that's not what I want my legacy to be. I want my legacy to be that I was able to move the needle. And it's not about doing great things. It's about doing little things that have the capacity to drive great change. So many of us want this big, great moment in our lives. I don't care about the great moment. I care about doing little things that have the capacity to drive great change.
Right. The Catholic in me can't help but make the reference, the parallel to Mother Teresa, who was just canonized, and that was how she lived her life. You know, it's the small things that you do that really add up to the tremendous change. So
you mentioned Mother Teresa.
Yes.
I was in the seminary. She was our commencement speaker.
Oh, how about it?
In 1979, and so I have a special.
You've had some tremendous influencers in your life, haven't you? Haven't you?
I have, and one of the recommendations that I think I've tried to guide my life is to target what you want to change. You don't have to change everything. For me, the problem that I'm trying to address is that in our lifetime, 1 billion people will go to their graves prematurely because they never had access to a healthcare worker. 6 million are children who die each year because they have no access to clean water and to medication and to a healthcare worker. Many people have said to me, Donato, that's not our problem. I disagree. Article 25 of the Declaration of Human Rights states that healthcare is a basic right for every single person. So that's what I'm focused on. The next leader should grab something that they can get passionate about. Passion, as Steve Jobs says, can move the world. I'm not that naive to think that I'm going to lower that number to 0 in my lifetime. However, I can make some impact. And if it is lowered to 900 million in my lifetime, that means we have been able to move the needle for 100 million people. And I shared the story today about Healthy Villages, which is the not-for-profit that I started 5 years ago. And I had a lot of naysayers who said, it's never going to work and you don't really know much about third world countries. And I'm glad I never listened to them. By the way, anytime someone has ever said that, I've done the opposite. But all I did was take the healthcare technology that we had created in my last company, and we brought it to the developing countries like East Africa. In 2011, infant mortality was 100 deaths per 1,000 births. I realized that we couldn't educate enough doctors and nurses to take care of that problem, so we educated the local villagers, 90 of them. We presented them our tablets and our iPhones with the medical app on pregnancy. Today, infant mortality has been lowered to 30 deaths per 1,000. 70 more babies are alive. If that's all we did with collaborative IQ and with integration and with compassionate leadership, what more can I say? If each one of us can grab to their own targeted, focused problem, we can move this needle.
Well, you're building such a legacy. I have one more question. I could talk to you all day. One more question for you, though. So, again, going back to, we mentioned Alex Draina. I know you're great friends with her. Do you ever see a day where social determinants of health, what Alex Drain calls the unmentionables, receive the same attention as chronic health conditions? And can there be equity in care delivery until we do?
First of all, let me start backwards. No, I do not believe that we can ever reach equality. I stated to you, I am on the board of the Robert F. Kennedy Center for Human Rights, and so I have a very strong human rights side to me. And I do think that healthcare, we have proven it at Healthways, that healthcare is more than just physical. Since 2006, we have interviewed every single day 500 people. And the questions have been tailored toward their physical well-being, their passion, their social well-being, their community, and their fiscal well-being. And what we have found is that, for example, a diabetic patient, if they have a fiscal hardship, they will spend $18,000 more on their diabetic care than someone who has diabetes but has a better fiscal, makeup. This is an issue that has to come out of the closet. We must address all of these other issues. I'm going to leave you with a great program that I'm now heading. It's called Silver Sneakers. Are you familiar with Silver Sneakers?
I'm familiar with Silver Sneakers.
Silver Sneakers is a program that is tailored towards the 64-plus population. And what we've done is we've brought together fitness centers, 13,000 of them. But let me tell you, we did not just sign up fitness centers. We have curriculums that brings the older person out of the home into a community where they're socializing with other people. Let me give you an example. I met last week a 93-year-old Silver Sneaker member, no children. She said to me, I would be in the hospital, I would be seeing my doctor But then she pulled a picture out. She said, "These are my 30 friends. They're Silver Sneaker members." She said, "They take care of me. They bring me to the fitness center. We go shopping. They bring me a meal every week." 93 years old. And we have outcomes showing how it lowers the hospitalization and the physician visits. That's why I say healthcare is a turnaround. You've got to invest in this while you manage the day-to-day care. And so I don't think you can ever improve healthcare in our lifetime if you're not willing to address those social determinants.
You know, and as you say, you know, looking at this 93-year-old woman's experience, health is social, and it's not something that you can achieve in a vacuum or by yourself. So, you know, thank you, Donato, for shining such a light on your experience and what you're passionate about.
Well, I'll close with a funny story. This same 93-year-old lady, we were talking about the day that Lee Harvey Oswald was shot, and I said, "No, it's November 25th," and she said, "It's November 24th." I said, "I don't think you're right." She said, "Google it." 93 years old, and guess what? She was right.
She was right. Sharp as a tack.
Yes. Thank you so much.
Oh
I
my
really
gosh,
appreciate it.
our pleasure, and
Thank you.
so inspiring having you here at the GuideWell Insights Lounge. Everyone, we're going to be up with another guest in just a few short minutes. Please keep watching. We'll talk to you then.
Thank you.
Hi everyone, and welcome back to the GuideWell Insights Lounge. My name is Kate Warnock, and we're here on location at the Oliver Wyman Health Innovation Summit. I'm delighted to bring our next guest, Mr. Mark Gantz. Mark, welcome to the interview.
Thank you.
We're happy to have you, Mark. You are the president and CEO of Cambia Health Solutions. So, Mark, you're here at the summit. You're going to talk on kind of a novel concept. It's about the integration or the alignment with a board and how a board can help a CEO really move forward. What are some of the points that you're going to make?
Well, it's been a really interesting journey. I would say that our board is, in some ways, our ace in the hole as a company. Over the years, we've assembled an extremely diverse, been described as one of the most diverse boards in the industry, and we populate it with people from around the country, from many different industries that have a lot to teach healthcare. Because we knew, as we were making the change from being a traditional health plan for much of our past to a total health solutions company that is really creating a new platform that will, in a sense, supplant the health insurance platform. We need people who had done that in their own industries and could help guide us and challenge us in the right direction. So it's been the relationship between our board and the management team is extremely strong, and it's a great partnership. And so I'm here with two of my board members, including my board chair, and one of my board members who lives here in Chicago, and we're going to talk about that.
Terrific. Well, you know, again, as I've been, I was researching your background, and again, knowing that the board was going to be your topic, you've been quoted as saying that board meetings are like full contact sport for how vigorously you debate ideas. How does this kind of rapport, which you've just referenced, filter down through your employee base, and can you be successful without it?
Well, I would say the board meetings really are that way. We went from the time when I first became CEO 13 years ago to at that time, a very traditional type of view, management coming in, providing operational reports, presenting fully baked ideas that had been wrapped up in bows that we would then defend from some questions from the board, and then they would vote and we would move forward. To now, one where if we use a PowerPoint, we're lucky to get past the second bullet on the first page and the board is engaged. Because what we do is, instead of, we've really dispensed with the operational types of reports. Those are all in writing, the board reads them in advance. We focus on strategy, and we bring to the board issues and puzzles that we're working on related to the strategy forward. And we've developed a level of trust where we can bring the board not fully baked ideas, ones that we have a point of view on, but we're still even exploring as a management team. And we invite them in to get their expertise. because we're paying them to be members of our board. Board meetings should be where we're drawing their expertise to help us. So that certainly filters into the management team ranks. We often have a number of the senior managers at board meetings because I want them to also witness the board engagement and the board perspectives, and they don't hold back. The board doesn't. They're very supportive of the direction we're going as a company, but they have some very sharp-edged conversations that are supportive yet
challenging.
Yes, challenging.
Right, right.
And generally, the team and the board are pretty tired after board meetings, and that's the way it ought to be.
They leave it all on the
To
table.
me, that's exactly.
That's right.
And that's how we
right.
learn, and it also creates a sense of buy-in by everybody
For
toward the
sure.
direction of the company.
So it sounds like you've really created a culture that starts at the top and filters its way down, where maybe the lower level employees are able to surface ideas and not feel any kind of fear or feel like it needs to be fully baked before they can present it, because
Right.
it's certainly what you're doing from
Yeah,
your perspective
exactly.
too. So terrific. All right, well, taking a look again at Cambia's portfolio, not only is your board diverse, but your portfolio is extraordinarily diverse as well. How does the rest of your enterprise, that includes this legacy company that you manage as well, benefit from the agility and the disruption of your newest players?
Well, I mean, the way I look at it is that the newer companies that we've either started up or acquired strong interest in, we view as ingredients to building the new platform that we're building. And so we evaluate them based on that. Obviously, we want those individual ingredients to be successful. So if you're baking something, it's really important that the ingredients be of high quality, right? The cinnamon or the whatever it may be. But what's even more important is how they blend together in the recipe to create what you're trying to create. And so that's how we think of the companies that we have. Because at the end of the day, what we don't need in healthcare is more fragmented, one-off solutions. There's an awful lot of that going on right now. And the good news is people are really trying to innovate in healthcare. The not so good news is that a lot of that just adds more fragmentation and confusion to consumers of like, what do I get? And what I think our research tells us is that individuals and their families are looking for an end-to-end experience in health and in sickness, from birth until completion of life. And we're building the platform to be able to do that. So, hence, that's why we've, quote, diversified, not because we're just diversifying because we think it's a good thing. It's actually very clearly aimed at in furtherance of our strategy.
Absolutely, absolutely. Well, one last question for you, Mark. So you recently stated that the health institution model is the enemy, not the people working in it. What are the changes we have to make to the model first so that we begin to truly see a consumer-focused health industry?
Well, do you have all day? That's a big question. The economic model that currently exists, I think, is sort of the enemy because it drives a culture where in senior management teams and boardrooms around the country in various aspects of the healthcare system, people make what seem to be logical business decisions, but they lead to suboptimal results. And we're seeing that play out right now with the EpiPen controversy. I don't know if you watched the congressional hearings yesterday, but the CEO was sort of unapologetic, saying, well, this is the way the rules are set out. We can charge what we want to charge, and we're going to continue to do it. So a logical business decision, good for the shareholders of Mylan and for the senior management team in terms of their compensation, but terrible for individuals and their families across the country.
Sure.
And that happens every day in all manner of healthcare decision making. What we aim to do is, through our platform, to be able to fundamentally change that economic model that sends those kinds of signals and creates a culture where the insiders really think they're smarter than the people they're there to serve. That's got to stop. It's wrong. And as a company that has been around for a long time and very strongly proud of our nonprofit taxable status, and proud of it because what it does is it keeps our eye on the ball and our focus on the long-term changes that need to be made. And that's what we're doing. So it isn't about bad people. There's always going to be rogues in any system, right? Even a virtuous one.
Sure.
But one that takes good people who get into the business for the right reason and reduces them to making logical decisions that don't lead to good result. Boy, oh boy, then you know the model's wrong, right, and it must change.
Right.
And
Well,
someone needs to step up and do it, and that's what we're trying to do. We hope we'll be successful. We're not going to be able to do it on our own, but that's why our cause talks about serving as a catalyst to transform healthcare, because we know we need to do it in collaboration.
Well, Mark, just a moment before you were on air with us, we had Donato Tramuto, the CEO of Healthways, and he was another one of the good guys. But speaking specifically about the role of health industry leaders like yourself, who, if they lead with compassion, can really, really make the change that you aspire to make. So I think that you would be counted among those compassionate leaders.
Well, thank you for that.
Well, thank you so much for joining us here, Mark, at the GuideWell Insights Lounge. We're going to be off soon with another guest. I hope you keep watching. Thank you. Hi everyone, and welcome back to the GuideWell Insights Lounge. My name is Kate Warnock, and we're here on location at the Oliver Wyman Health Innovation Summit. I have another distinguished guest joining us here. This is Maureen O'Connor. Maureen, welcome to the interview.
Thank you, Kate.
Maureen,
Happy to be here.
We're happy to have you. Maureen, you are the president of Mosaic Health Solutions. Let's get into your questions. I don't know if you have heard of Ingrid Lindberg. Ingrid spoke at AHIP this year, and she made a quote that made me think of you. Ingrid Lindberg has said that the health industry has to nail the basics before it can delight the customer. How have you managed to ensure that Mosaic is positioned to do both for its stakeholders?
So I would begin by saying I totally agree with Ingrid. I do think we have to nail the basics. And maybe begin by saying for healthcare, as opposed to some other industries, I think the basics are incredibly important, and I don't think we are there yet in even being close to nailing it and getting it right. So for me, I would define the basics as delivering quality care to people, certainly providing the access that they need to really good quality options, and then affordability. And again, I think we have challenges on all of those fronts. So I'm in complete alignment that we need to nail the basics. I think Mosaic Health Solutions, which is the strategic investment arm of Blue Cross Blue Shield North Carolina, it's not as if the health plan is all focused on nailing the basics while we are out innovating in these amazing new solutions. We're actually looking for solutions that can help us get the basics right. And so, we're doing that by investing in companies that, for example, can keep people out of the emergency room, or can help people as they're trying to manage, sort of high cost drugs for people with chronic conditions, telemedicine. So we've got a whole suite of solutions. What I will say is that we are very much focused on the future and sort of where healthcare is going and where it needs to go, and not investing in companies that are going to perpetuate the status quo, even if they're profitable. So we're, honestly, we're in this business both to make money. So it's a for-profit part of the organization. So we're looking for that return on capital. But it's incredibly strategic what we're doing. And so we want to really focus on those opportunities that are going to change healthcare for the better and really drive the kind of change and the pace of change that we need. On the issue of delight, that's a word that's used a lot right now. Again, I think unfortunately the bar is fairly low in healthcare. So if you think about a consumer experience of, just this week, I tend to order, I'm an Amazon Prime member, And I have certain expectations of what that's going to feel like. So I can do it in the moment, I can do it quickly, I get what I want, I can look at reviews for what has been a great experience for someone else, and then complete the transaction in seconds. In healthcare, if I want to schedule an appointment online, for example, around my own convenience, the likelihood of me being able to do that is actually pretty low right now. If that exists, and it does in some markets, that's viewed as a big deal. So the whole notion of delighting, it's actually sort of a different bar, which means we have a ton of opportunity. Right.
You know, it makes me think, Maureen, of how Terry Stone here at the summit opened this morning, and with several patient testimonials, and just how far we have to go in getting, like you said, in getting to that delight point when the basics are so infrequently met. So
that's right. That's right.
So good for you for having that strategy of looking at those companies that can help really get those basics right and then build from there. Yep. My next question for you, Maureen. Why is it important to Mosaic that not just consumers, but providers and payers all benefit from your collaboration and investment opportunities?
Yeah, so I think if you start with the consumer at the middle, at the center, and say, how does a consumer, you're a consumer, I'm a consumer, how do we think about healthcare? We don't put it in these silos where we're saying, well, what's the payer experience? What's the provider experience? What's the retail pharmacy experience? It's just their healthcare, it's their life, and they're expecting those stakeholders, if you will, to work together to sort of figure it out. And so we talk about navigating the system and how complex it is, but I think there's a huge opportunity to really start thinking about healthcare very differently. So, and that is across all of these various stakeholders. And so when we think about investing, we do think about it that way. If we can find a solution that's very helpful to payers, that's great. But boy, if it helps providers as well, and if it helps the consumer in the mix, that's sort of the triple play that we're always looking for.
Right.
Maybe give you an example. So a health plan may have a goal, and this is not a crazy one, most health plans do today, particularly with the Affordable Care Act, of trying to reduce emergency room utilization. It's high, and it's still high. So Mosaic has invested in, I can think of 3 companies, an urgent care company, which is based in the community, provides really easy access in and out, similar to what Terry was talking about this morning.
Yeah.
We have made an investment in an urgent care company that pleases the consumer, it's lower cost, and for many providers, if at first we thought that would be a little challenging for the provider community, we found it not so, that it's just another channel for their patients to use when their office isn't open. Access Point Health is another company. It's a care management company. People can call and talk to health coaches and nurses when they have a particularly difficult situation. Again, that prevents people from then going and accessing care in places that are inappropriate because they now have that person that they can talk to. And then maybe a third example would be a company we invested in called TouchCare, which is a telehealth company. And again, the ease, really thinking about the consumer and the payer of being able to do a fairly basic needs kind of visit without having to leave work, get in your car, doing it on the spot. And this particular model involves having that visit with your own physician. So, those are examples where I think it's sort of a win-win, and that's what we're trying to achieve.
Absolutely.
Yeah.
Well, Maureen, as I was preparing for this interview, I was doing some research on you, and you've had a fascinating career. I was hoping that maybe you could share some of the personal milestones as you progressed from being a general counsel of a company to an innovation officer. Maybe not a natural progression, but here you are.
Exactly.
Yes.
Well, it's been a really, fun journey. It is an interesting one because you think of someone who's general counsel, focused on regulation and compliance, as being wired in a certain way, maybe an innovation officer wired very differently. If I had to think of some common threads, I would say I love solving problems, and the bigger the problem, you know, the more important the problem, the more I am energized by that. So I think I'm almost by nature a problem solver. I also am someone that not only isn't concerned about change. I actually thrive in an environment of change. I like change, and I've been in healthcare for over 30 years. So I wouldn't say I was passionate about healthcare right out of the gate, but it has grown, and I'd say the last particularly 10 to 15 years, there is, again, just so much opportunity to make it better. So if you put together sort of that interest in solving big problems, very interested in health policy, and then the newest part of my career actually has been working with earlier stage companies, and that has been fascinating. I mean, I just, again, love the energy, love what they're doing. They don't always work. You know, you have to be able to sort of deal with failure.
Right.
But when they do work, it's amazing. And even when it doesn't work, you learn from that and you move on. So, yeah, I've had really a terrific career. I almost look at it as having, 3 or 4 different. I've been with the same company 17 years, but I feel like I've been in 3 or 4 very different jobs.
Well, I'm sure that Blue Cross Blue Shield of North Carolina and Mosaic is so fortunate in having you in the role that you're in, and what a wonderful time to be in the role that you're in with such
really
an exciting industry. So, Maureen, thank you so much for joining us here at the GuideWell Insights Lounge. My name is Kate Warnock. We'll be up again with another interview really soon. Don't miss it. Hi everyone, and welcome back to the GuideWell Insights Lounge. My name is Kate Warnock, and we're coming to you live from the Oliver Wyman Health Innovation Summit. And boy, do we have a very special guest or two. We're here joined by Jacob Hoskins and Pepper. Jacob, welcome to the interview.
Thank you very much. Happy to be here.
We're happy to have you both here. This is a first for us for the GuideWell Insights Lounge. So, Jacob, you are the Director of Business Development for SoftBank Robotics, and Pepper is a humanoid robot. I was hoping that maybe you could show us a little bit of what Pepper can do.
Sure, happy to. So Pepper's a very popular humanoid robot deployed in Japan and Europe, and it's going to be coming to the US in the future. So happy to show off some of Pepper's capabilities. So this scenario is where Pepper is greeting a visitor as they're leaving the hospital.
Right.
Thank you for visiting Pepper Hospital. Before you go, can I ask you a few questions about your visit?
Sure.
On a scale of 1 to 10, how likely are you to recommend Pepper Hospital to a friend?
Not the best day, a 5.
I am sorry we didn't earn your strong recommendation. Can you let us know how we can improve?
It was really slow.
I am sorry for the slow service. Can you please let me know which department had the problem so we can work to fix it?
I had an MRI today, Pepper.
I have alerted the manager of the radiology department so she can fix this issue. Would you like us to personally follow up with you on this issue?
That's okay.
We appreciate your business and are working hard to improve your experience at Pepper Hospital.
Well, Jake, this is pretty extraordinary technology, obviously.
It is.
So this is an interesting use case. Why don't you give us a little bit more about how this might actually work in a real environment?
Sure. So we designed Pepper to gather real-time feedback for businesses, including hospitals, so that way they can see how it worked for the customers. Did the customers have a great experience? And if they didn't, what went wrong? And that way we can send that data back to the hospital in this case. That way they can fix it after only 1 or 2 people had a bad day at the MRI, instead of having 100 have a bad day and impact the quality score. So it's very much a real-time sensor into their business.
Okay, and so is this something that, Pepper would be just wandering the floors of the hospital? How would this be deployed?
So the hospital would pick how it works best for their operations. Typically it would be near where people pass through, so right near the front, in the lobbies. That way people can be gestured, come on over, would you like to help us improve our hospital today? A lot of people say yes. They want to talk to a robot and also want to help the hospitals improve.
So I imagine that one of the values of having, this really fantastic technology is, the appeal, it's the novelty of it, but it's also in the consistency with which this is going to behave versus perhaps a person that's going to require breaks or might not capture all of the questions on their survey, that sort of thing.
Yeah, so Pepper is going to ask the survey the same way every time that your statistician set it up to be asked. It'll ask that. It'll also give you back the data on who is answering the survey. So it would detect you're an adult female, I'm an adult male, and my answers will get added to that. So it'll say I had a bad day at the MRI, and this male in his 30s had a bad day, but if you had a great day at orthopedics, it would be able to give that color. So if they're having a particular problem, let's say with females in radiology or males, it can give that more guidance to the department head to fix it.
And so you were indicating to us before there's actually a camera right here in the little forehead area. How does that work then? As you said, they're capturing some of that demographic information.
Correct, yeah. So the camera looks at the people that come up to Pepper, and based on the analytics inside of Pepper as well as what's in the cloud, it makes estimates of your age and your gender. It also knows how tall you are. And so that all that information gets bundled with your answers to the question in this case.
Terrific. So it really is giving that needed insight to whomever is using this technology and how to improve. Yeah. Well, great. Well, so Jacob, I was hoping you could share a little bit more. Where have humanoid robots already impacted healthcare?
Yeah, so we're still in the early days of humanoid robots impact to healthcare, but we've seen very positive examples so far in Belgium, where their Peppers are being used to guide people around the hospital.
Oh, how about it?
It is. When you go to a hospital, it's your first time, you don't exactly know where to go, it's stressful. If a robot says, hey, I can help you find the right department, it really lowers your stress level and has you have a better day.
How about it?
Also being used in Japan to lead exercises for elderly people. It's very important they exercise, and Pepper can lead those. And then also, in the future, it's going to be able to alert caregivers of if somebody's falling behind on the exercises, they can have one of the nurses go check out the patient and say, hey, are you having a good day? Let me help you.
So really, this is a very high-tech but high-touch sort of application, isn't it?
It is.
Yeah.
I mean, Peppers are designed to really help people, and then as the people that are dealing with Pepper need a handoff to a caregiver, that facilitates really easily. So Pepper would say, hey, one of the patients in the hospital needs help. Please go help her.
We had some presentations earlier in the day that was talking about design in healthcare, and just looking at this, I'm wondering how many iterations of this design do you think happened before we have this model in front of us?
Sure. So you're looking at about 10 years of design and R&D experience. And the cool thing about Pepper is that you're not just looking at a robot today, it's getting smarter every day because it connects to the cloud, and our partners like IBM and Microsoft, as well as many others, are working hard to keep pushing the technology envelope. That technology then finds its way into Pepper, and the Pepper you're going to have in front of you next year is better than the one this year.
How about it? Well, so it's such an exciting thing.
It is. It's very exciting.
One final question for you, Jacob. What can healthcare learn from other industries in building a service model that include humanoid robots?
Sure. So the key thing is being able to get information into your business and then take action on it. And so Pepper's really able to gather that information in and serve as an information endpoint for your technology. So the same things you're putting into your apps, and you're giving apps to your customers, but usage isn't what it would like to be for every business. Pepper's easy, brings you in, teaches you about the product, service, whatever the business is trying to talk about, and then delivers the information back to the business on what's resonating and what's not. And that process of iteration is standard in many industries, and I think healthcare is now, at least on the customer experience side, just embracing that. And Pepper's a way for them to gather that information and give it to the enterprise to really improve their operations.
Well, it's a remarkable piece of technology, and we're so grateful that you found your way here to us at the GuideWell Insights Lounge. Jacob, thank you for your time. Pepper, thank you for your time. I hope that you continue to watch our live stream here at the Oliver Wyman Health Innovation Summit. My name is Kate Warnock. We're going to be up soon with another guest. Keep watching.
Thank you.
Hi everyone, and welcome back to the GuideWell Insights Lounge. My name is Kate Warnock, and we're here on location at the Oliver Wyman Health Innovation Summit. And I have a wonderful guest joining us right now, Alexandra Drain. Alex, welcome to the interview.
Thank you so much. I'm so happy to be here.
We're thrilled that you are here. So Alex, you are the co-founder and board chairman of Eliza Corporation. Eliza, or excuse me, Alex, you presented today on how to make consumer engagement make business sense. What were your top points this morning?
I think one of the things that we have forgotten in healthcare is if you want to sell more of something, you have to sell something people want to buy. Right? I think often, especially with technology, we are technology in search of a problem, as opposed to thinking about how do we solve the problems that real people want solved. And I think of things very simply in a Maslow's hierarchy kind of way, which is we're talking to people about being their best self and exercising and taking care of their diabetes. Meanwhile, for far too many individuals, their marriage is falling apart, and their mother with Alzheimer's just moved in, and they hate their boss so much they can't breathe. And then increasingly what's getting attention, as you know, is we've got this whole population that actually doesn't have safety, doesn't have food, doesn't have clothing, right? Doesn't have the basics. And one of the things we talked about today, which I think is a fascinating topic, is loneliness as an example of something that is really a problem in the healthcare space that we're not talking about. And I think we need to meet people where they are in the messy realities of their lives, think about the things that are stressing them out, waking them up at 2 a.m, and those are our problems, right? These are the problems that we have to solve because they are not only keeping people from focusing on making healthier choices, being healthier, they're actually robbing them of their health. These life challenges are shortening telomeres and ultimately killing people.
Absolutely, and I know that this would resonate with you. We had Donato Tramuto on before, and he was saying that he just finished writing a book, and he was in a position. It was just a few months ago, keynoting an industry event, and the venue convinced him to talk about the book, and he said, "Well, I wasn't really thinking that I was ready to do it, but he did," and it was about those bulldozer moments, and so talking about those things that can kind of take you down in life. Not everyone necessarily always has the resources to build them back, build themselves back up like Donato did. So I think what you're trying to shine a light on is health is more than just that episodic. Did you get the flu shot? Are your vitals where they should be? It's so much more.
Well, it's funny. I often say that in healthcare we have two personalities, right? We have the personality that we bring to work every day where we feel wonderful about lecturing people about all the things that they should do, and then we go home and we don't do any of them, right? We take terrible care of ourselves. We drink too much, we don't sleep, we cancel our appointments because we don't want to go to them, we don't go exercise. There's actually a point that came up today on the panel that I think is even more important than that we as healthcare professionals, team members need to take into very serious consideration, which is these life challenges are happening to us too. So it's not only that we ourselves are not taking good care of ourselves, we're also having life stress. So Kyra, who gave this incredible keynote, then comes out afterwards and sits on the couch and says, well, my dad is actually going through this terrible health thing, so I don't even feel like I'm really here. And Kent talks about the stress that he went through with his mother. And I think if we literally had taken the microphone and run around the room, while you see all these executives sitting here somewhat present, at least some percentage of a not insignificant percentage of their brains are off solving another problem that is in their home, it's related to something deeply personal, and it, again, is causing a health challenge for them.
Well, I want to bring it back to your background and your experience and what you've done in the health industry, Alex. It's so important. Eliza Corporation conducted studies which really truly got to the bottom of what prevents most people from taking care of their own health. Can you tell us why empathy might solve for those concerns?
Yeah. Well, what happened to us was we, like everyone else in healthcare, was solving the problems that we think matter. So we get measured based on HEDIS. We get measured based on metrics that are around clinical factors. And the beautiful thing about Eliza is we sit on this communication platform that lets us interact with a huge number of people on a regular basis. And we don't believe in talking at folks, we believe in really having a conversation, and part of a conversation is asking questions and listening for responses. What we noticed is we would say to somebody, are you going to get a mammogram? Will you take care of your diabetes? And some not insignificant percentage of people would come back and say, no, I'm not. And we would say, okay, why not? And we'd go through a list of the reasons that the literature said were true, like, I'm afraid of finding out the results, it's scheduling, it's transportation, it's cost. But a huge percentage of people would say no, 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 no. So we learned, thank you, Susanna Fox, to say, what's the open-ended question? Well, why aren't you? And you'd be amazed at the number of people who would say, oh, I would love to take better care of my diabetes. I know I need to get my mammogram. Absolutely, I'll go get my yearly physical. I just can't right now. My husband just lost his job. I'm caring for an aging parent. And I'll tell you, when the data comes back to you in the form of real humans sharing real hardships that they're having, real stories, individual little snippets, snapshots into where their lives are breaking down, that creates empathy. And I don't think you can continue to lecture somebody about all the things they're not doing that the healthcare system thinks they should. Once you feel for a minute, oh my God, this person's deeply sad, deeply lonely, deeply stressed. And so I think when you put yourself in that position, then you can't help but begin to think on the behalf of the consumer, the patient, the human, the soul that you're serving. What do they need from us? What they need from us is help with their financial stress, their relationship stress, their caregiver stress, right? And you can call it something as basic as stress management, which are tools and tricks that we can teach people at health. But I think that there are other things we can be doing, connecting caregivers to other caregivers, right? Connecting people who have financial stress to online tools and services and networks that can help them. There are a lot of things that we can do. My last point on this is sometimes people will say back to me, I get a lot of like, well, you're so cute. That's such a cute idea, but that's not healthcare's problem. Yes, it is healthcare's problem. And I would say it's actually healthcare's opportunity because these things are costing money, real money, and they are hurting people's health.
All right, so you take me to my next question. Actually, before we start the next question, I have to share that when you walked on stage this morning, you were preparing to moderate a panel, and you said, "I can't believe how much I feel like I'm amongst my people." When I hear words like compassion and kindness and empathy, and how unusual is it for you to be in a setting with leaders like this? I mean, Oliver Wyman brings, very, very senior level executives here to hear that kind of vocabulary in an industry event.
Yeah. It's funny. What I was going to say, but I thought it would be dorky. It is dorky. Is that I really was sitting in the back behind the stage, like holding up my Bic lighter. This is how old I am. Like this, like, oh my God, I can't believe we're talking about this. And it was an extraordinary thing because usually all you hear about is these, and let's be clear, helping someone take care of their diabetes, of course that matters. That's not the point. It's just, we haven't earned the right to help someone with their diabetes until we've helped them with the stuff that's stopping them from even going forward in life. And so to hear titans of industry legitimize on a stage in front of folks with big budgets and big populations, because that really matters, right? Talking earnestly about the need for kindness, the need for compassion. Empathy is a true North design principle. Asking people, what are you doing to these ends? I was essentially speechless. I was like, oh my God, it was wonderful.
Well, no better industry to really start adopting that kind of vocabulary and that mindset than healthcare.
Yes.
Where we're all consumers and we all benefit from that sort of high touch, and care.
Well, and I think what Sam said, what Terry said, what Kent said, what was repeated over and over again is, guys, that's why we got here in the first place. Yeah. This is what healthcare is, right? This is why we came into it. It gets beaten out of us over time for legitimate reasons that we have to address. But the core of why people come into this space is to help other people be happier, be less alone, be healthier, have less fear. Right? It sort of gets beaten out of us a little bit over time.
Well, all right, until people like you shine the light back on it. So, all right, I have another question for you. You have been, Alex, a successful serial entrepreneur for your entire career. Kudos to you.
That's not true.
You've been a serial entrepreneur with some successes, great successes along the way. What advice do you have for people looking to leave their imprint on history, which is something you yourself are looking to achieve?
Yeah. Well, the first thing I would say is I think as entrepreneurs, and you and I have talked about this before, we owe it to each other to share our failures, to share our learnings, to share the things that aren't working. Partially because then you can help Esther Dyson, whom I love madly. She has the term make new mistakes. And so if I share all of the stupid things I screwed up in the last little bit of time, I help you avoid those. But I think even more importantly, changing the world is hard. And doing new things is hard. And when you're out there doing it, you're going to make mistakes. It's going to be an iterative process. And if all you're surrounded with is people telling stories about how their business is awesome and everything they're doing is awesome, when that happens to me, I feel badly about myself. And I start to think I'm a loser. Like, what's wrong with me? I must be the only one who doesn't get it. When I'm around entrepreneurs who are generous with sharing, of course their success, but just as much, let me tell you all the mistakes I've made, then I sort of get the inner power to be like, okay, then I can go at it again, which I think is really, really important. I think what we need to figure out as humans is what is the thing that we feel most called to do to change the world. And as I have been getting more and older and more introspective and more reflective of what I'm really tortured by, I want to help people feel less alone. I think all of us feel alone. And even the most successful person in the world, in the dark of the night, left to themselves, is stressed about something. They think they suck at something. They're worried about something. And I think if we could connect together, commune better as humans, and share more about our hardships, I might not be able to fix the thing that's wrong, but at least I can let you know you're not alone in the thing that's wrong. And I think that's key. So I think for each of us, it's just a process of paying a lot of attention to what turns you on, like when do you hurt when people are describing something, and pay attention to that, because figuring out what you want to do to change not only will make you feel better, but I think it helps you focus so that you can go ahead and have that impact.
You know, so you talked about Maslow's, operating in Maslow's law, and I think the way that you describe it, you're enabling people to operate at their highest and best self when you're taking care of their whole self. So, what a tremendous mission that you have, and we're so fortunate to have you here sharing your insights with us. Certainly hope we get to meet up with you again, Alex.
Yes.
It's been a delight.
Thank you.
So, all right, well, we're here at the GuideWell Insights Lounge. We're live streaming. We're going to have another interview with you in just a moment. Please keep watching. Thanks so much. And we're back live here at the Oliver Wyman Health Innovation Summit. Hi everyone, my name is Kate Warnock, coming to you from the GuideWell Insights Lounge with our next guest, Mr. Crispin Ellison. Crispin, welcome.
Welcome, lovely to be here. I've flown over from London.
We're so happy to have you, and I know that you're here just a day after arriving, so God love you for managing the jet lag, but as you said, you're used to it, aren't you?
Yeah, I do a little bit of air travel. Yeah.
Just a wee bit. All right, well, Crispin, your role with Oliver Wyman is you are a partner for the health and life sciences practices. So, all right, so let's start with your first question. I know that at this year's World Economic Forum annual meeting at Davos, you moderated a panel on all things sugar, obesity, and diabetes. What are the challenges to change?
Yeah, I mean, we had this panel at Davos, which was well attended by some government leaders, quite a lot of food industry leaders, which was good to see, and also healthcare and some NGOs and other action groups.
And some celebrities sprinkled in there too.
Yeah, we had the White House chef, Sam Cass, who he just left being the White House chef, and he had been Michelle Obama's director looking at this problem in the US. And he was the star of the show, mainly because he came up with this great comment, because everyone was saying we need to eat, more fiber and all of that. And he said the trouble is, you look at the advertising for sugar, for chocolate, for sweets and all of that, and it's all sexy, it's all glamorous. And the advertising for fiber is all do good. And he said, sex beats fiber every time. And that was the most highly tweeted comment in Davos that day. So that was a big success.
Your panel,
it was a big success.
Excellent.
Absolutely, yeah.
I love it.
But I mean, broadly, what we were looking at is, there's two sort of sets of. It's a difficult challenge. We've got 415 million people in the world with diabetes at the moment. Looks to increase by 50 to 65% by 2030, that number. And one of the really interesting things that came out was the financial implications of long-term disease, because the World Economic Forum had done a piece of work to look at the cost of long-term disease globally. And their analysis was that it was, by 2030, long-term disease would cost us 5 times what the economic crash of 2008 cost the world.
Oh my goodness.
Which I thought was a really interesting...
Pretty arresting, isn't it?
Yeah. And sugar, diabetes, obesity is a very significant chunk of that long-term disease crisis. So, broadly, you've got to either change customer behaviors, and of course today we've been talking about the difficulty of actually changing the customer behavior, how subtle you have to be, and or you have to change the behavior of the producers and retailers. And you've got those sort of two audiences to really look at. And you've got sticks and carrots to sort of achieve that. I mean, it's not in the interests of the retailers and producers to, kill the fatted calf of sugar, which is, significantly important to their businesses. So, there is something around sticks and carrots. And we really sort of three levers that we sort of focused on. Education, which is very much aimed at the individual customer, the citizen. And then the stick, which is really tax and regulation. Regulation, I think what we were talking about mainly is sort of advertising. Advertising for children eating lots and lots of chocolates. Different countries, I think, have a very different view on this. Norway's got a complete ban, on advertising inappropriate foods for children, before such and such a time at night. I think in this great country, putting restrictions on advertising are rather more difficult.
I believe so. Yes.
But you've got things like that. Then you've got things like stopping the offers. And again, there's this whole, it's this whole thing of sort of Big Brother interfering versus freedom to make your own choices. But let's stop giving 2-to-1 offers for a bottle of Coca-Cola. Let's stop piling chocolates up by the checkout in your retail stores. And again, some countries have started to make progress there, but the political climate in different countries is very different, I think, around that. Sam Cass, the White House, he was very much looking at education rather than the sticks, and focused on trying to educate people to and to engage them into really understanding around this. I think everyone found that interesting, but it's a very long-term approach. And if you've got advertising campaigns working against you, is it enough on its own?
Right.
And then we had a long talk on the vexed subject of sugar tax, which is something that I know quite a bit about, having worked with the British government, who are introducing a sugar tax at the moment. Without wishing to sort of go into detail, I mean, broadly, if you want to tax something to stop people doing it, the evidence is you probably have to tax it at about 50% or more. And there's no way that people are going to go for a sugar tax of 50% in any normal country. Mexico's recently introduced a sugar tax, and it created a dip for about 18 months, but it very quickly recovered. It was about a 10% tax, 15% tax. But I'm not sure, again, that the Mexican tax system is things that necessarily people would wish to emulate worldwide. And so what we've done in the UK is, rather than tax at the point of sale, tax the consumer, we're actually putting a levy on the producer. And we're saying to the producer, if you have more than 8% sugar in your drink, then you will pay a tax at this rate. And if it's 5%, you'll pay it at that rate. Now, so we're trying to encourage the producers to reformulate using less sugar. They, of course, have the choice of ignoring that and passing the cost on to the customer. But I think it's an interesting one, and we'll see how effective it is. Canada are looking at the same problem at the moment and are looking at those two options. Prime Minister Trudeau is very keen to actually sort of address this. But I mean, I think that's a sort of summary of what we did at Davos. Yeah.
It must have been just a fascinating conversation, because again, there are so many different players involved, and when you talk about education, how early is too young to start, and how do you, is it better to educate the parents of the young children, or do you start with the young child and trying to influence what they consider worthy of putting in their mouths? I mean, it's such a fascinating conversation you must have led.
I think it is, and an ongoing one. But I think the whole business of, if you wanted to, and there are other events going on here, I sort of a very interesting discussion before lunch, but looking at how you influence long-term disease, and it's certainly not through healthcare. Healthcare is what picks up the pieces, sometimes well, sometimes fairly inadequately. But actually, if you want to address this, and it's, people will argue, but about 70% of the cost of healthcare is in long-term diseases is behaviourally driven. then we need to be looking at using education. We need to be looking at social care. We need to be looking at the economics of communities and societies, because contrary to what a lot of people think, sugar consumption is much highest amongst the poorer and more deprived communities in our society and in the poorer countries in the world. They have the highest growing obesity problem. It's in the poorer countries, and it's a much bigger problem now than undernutrition globally. So, we will see where we go. I think it's a big challenge.
Well, certainly a topic worth exploring at a venue like Davos, where you have such global participation. Crispin, in our final moments, I was wondering, you've talked about maybe, exploring taxing the producers or introducing education. Is there anything else that governments and health services can do to really help influence the way people behave and ultimately, hopefully, have healthier outcomes?
I think there's something about governments taking this seriously. A lot of this is about leadership, and I think it's interesting the way that Trudeau is taking the lead on this in Canada. But a lot of it is about leadership, and indeed Michelle Obama in the States, although I think the program has had less traction here. I think a lot of it is about leadership, and I think a lot of what events like this can do is pull together some of the evidence to persuade governments it's a real issue, because I don't think any government in the Western world would think it at all surprising if you said one of your key priorities is not to have another financial crisis. And yet, I say, the World Economic Forum numbers, not ours, but their numbers, are that this potentially, long-term diseases will cost 5 times as much by 2030. So getting on top, getting on top in terms of prevention and actually trying to tackle the behaviors that cause it. Right. There's a huge win out there and a huge amount of pain if we don't do it properly.
Well, Crispin, thank you for bringing to light such a very global topic, something that impacts all of us, financially or just population health really writ large. So appreciate you spending your time and your insights with us here at the GuideWell Insights Lounge. My name is Kate Warnock. Keep watching. We're going to be up with another interview in just a moment. And we're back live here at the GuideWell Insights Lounge. Hi everyone, my name is Kate Warnock and we're live on location at the Oliver Wyman Health Innovation Summit. I have another distinguished guest joining us here. This is Darren Gordon. Darren, welcome.
Thank you. Thanks for having me.
Well, we're happy to have you. Darren is the former director of TenCare. Let's get right into your
Sure.
questions. So Stat News recently reported on the rise of the quote-unquote bedless hospital. As more care transitions to outpatient facilities, does this create concern or opportunity for underserved populations?
Oddly enough, it can create both.
Okay.
And so think first from a concern perspective, you have traditionally seen outpatient services in the hospital helping to offset other costs that you see within the hospital system. And so to the extent you take some of those services out of a hospital, then you are probably going to see the prices rise for some of the other critical services that can only be provided in an inpatient setting. So in some cases, you could see small rural hospitals, if they're impacted, a certain degree of having too much of that outpatient service move away from the inpatient, the core of the institution, you could see some of them struggle financially, and so you may end up losing some access points. So conversely, to the extent that some of these bedless hospitals are going to be closer to some of the underserved populations in rural and frontier areas of the country, you make it more convenient. I'm not under the impression, any stretch of the imagination, that they will actually be located in a rural or frontier area for economic reasons. But to the extent it's more convenient for some of those populations, then that could help improve access. Generally, the system's going through an evolutionary change, and we've been on this track for a while. You've been seeing this with the creation of some very businesses that are outpatient centric for quite some time being very successful. I think that trend's going to continue. So we just need to be careful as the system morphs, that we watch to make sure that some of those essential services that have to be provided still in an inpatient setting are able to adapt and still be available and accessible to the populations that we're talking about.
Absolutely. Well, I have another question. I couldn't resist asking you because, again, in the number of years that you were in your role, I thought this might be relevant for your response. So HHS just approved $87 million to fund EHR investments in health centers across the United States. Why is it important that federal funds continue to flow this way?
So EHR investments are important. We'll say that. Now, to date, I think there's been some debate of whether or not the initial investments that have been put out into the broader health information exchange and EHR programs is suboptimized, because some of the systems still aren't communicating well together.
Sure.
So I think to some extent, we all want to see us get to a better place, and we're not quite there yet. With that said, these types of investments, to the extent that it's helping some of those providers, which these were particularly geared toward, helping providers be better equipped to function in a value-based payment role, and to transition as you're seeing care delivery systems evolve. You want to make sure that they're set up for success in that evolving landscape, and that's essential. So, it's a necessary tool. But to the extent you're doing those investments and culturally within those practices, folks are not really wedded to fully utilizing those systems, again, I think we're just going to see suboptimal outcomes from the investment. So it's a slow, long process trying to help folks along, as there's so much change still going throughout the healthcare system. You can't leave folks behind.
Absolutely. All right, our final question for you, Darren. The summit here is actively exploring the theme of population health that takes a more personalized and holistic approach to care. How will health policy continue to influence the success of this expanded definition of care?
Health policy is essential here. To the extent we ignore these interrelated components that are such directly correlated to a person's health and well-being, we will not see the type of care and quality of life that we'd want for our citizens. So it's essential that the policy is recognized, and you're starting to see that. States all across the country have already been looking at the value, and I won't only say states, but looking at it, there's evidence, there's good scientific evidence behind the value of medically tailored nutrition therapy. When a person's leaving a hospital, to the extent that they are able to get medically tailored nutrition therapy, they've seen a reduction in readmission rates. It's very important, things that we hadn't thought of before. But then you can get into housing, to the extent some of the populations that we were serving in the Medicaid population, you can have challenges expecting someone to be compliant with a regimen when they don't have a place to stay.
Right.
And so, oddly enough, we're very complex organisms, and so there's a lot of factors that really influence how we live. And to the extent policy can enable this broader viewpoint, not necessarily that the healthcare system provide it, but that we look beyond the tool chest that we have in healthcare and recognize that some of the things that we can look at from a social perspective, the benefits accrue to the bottom line of the healthcare system. And so anything that the health policymakers can do to continue to broaden that perspective, broaden that view, in the end, I think is going to be beneficial to the people we serve.
And I think it's important too that events like the Oliver Wyman Health Innovation Summit, they take the top industry executives to really deeply explore these themes and really look beyond the checklist to impact population health. So that's why you're here, and we're so glad that you were invited to join the summit, because it meant you could be a guest with us. So Darren, thank you for your time. Thank you for joining us. We're going to be up soon with another interview. My name is Kate Warnock. Please keep watching.
Thank you.
Hi everyone, and welcome back to the GuideWell Insights Lounge. My name is Kate Warnock, and we're here live on location at the Oliver Wyman Health Innovation Summit. I have another distinguished guest with us, Helen Leese. Helen, welcome to the interview.
Thanks, Kate.
Helen is a partner for the Health and Life Science practice at Oliver Wyman. You have had a very busy day, and I know that you've got a lot more work ahead of you, but we've got some great questions for you to answer. So, how come the concept of transforming healthcare from the outside in is so distant from what's happens historically?
Great question, Kate. Historically, healthcare has been a B2B business, so businesses calling on businesses. And when you think about hospitals and physician groups, they were really designed for the convenience of the physicians. And then when you think about health insurance plans, they were really designed to meet their customers' needs, the employers. Right? So no one was really thinking about the consumer or the patient. They were almost an afterthought. So that's part of the reason why it's been so difficult. I spent 10 years in the first part of my consulting career working with consumer goods companies. So the thinking about who is our customer, what do they need, what are their priorities, what are their hassles, is something I was asked to bring into the health and life sciences practice when I moved over 7 or 8 years ago. And I found that that is a very different way to think about the business model than health plan executives and provider executives have been accustomed to.
Right.
So that change in thinking, I think, is the most difficult part.
Right. But what a wonderful thing that they had the foresight to bring you in because of that experience,
Yes.
because that's exactly the kind of disruption that we're looking to bring to healthcare.
Yep.
Our next question for you, Helen. What can healthcare learn from other industries in terms of how to create a magnetic relationship with the consumer? So you're a perfect person to speak to this.
Sure. So when we think about magnetic offerings, we're looking for 3 different dimensions. The first is the functional. So what's the job that you're going to do for the consumer? What is the hassle you're going to eliminate? What is the problem you're going to solve for them? And anything that you're building in an offering has to cover that first. The second is the emotional element. So it's building that connection, that human empathetic connection with the consumer. And the reason you want to build an emotional connection is 2. One, we found that brands who have emotionally connected consumers do more business. If you have consumers who are highly satisfied, they'll do, let's say, 5x business. If you have consumers who feel emotionally connected to your brand, they'll do twice that. So just in terms of driving more volume and activity into your business model, we think that's a good thing. The other reason you want that emotional connection with consumers is because it gives you permission to fail. So have you heard the Southwest and United Airlines story today?
Oh, Sam, why don't you tell our audience? Sam had that graphic up on the screen today.
Okay.
He did. Mm-hmm.
So United Airlines, when you compare to Southwest, doesn't perform that much worse than Southwest. Southwest still loses bags. Southwest still has canceled flights. But United Airlines has 20 times the amount of customer complaints. Why is that? Southwest has built an emotional connection with their passengers. Southwest CEO is blogging about what's happening behind the scenes. There was a famous story several years ago when the roof of an airplane was sheared off a Southwest airline. Now, normally people would think, I'm never flying Southwest again. One of our Oliver Wyman alumni, like the week before, had taken the role of chief operating officer there. And he and the CEO were out blogging and telling consumers, this is what we know, this is what we don't know, this is the process we're taking, this is why we know you're safe. Right? That gives that emotional connection, that transparency, gives you permission to fail so that consumers are still willing to do business with you. The third piece of what makes really a magnetic business offering is the economics, right? It's economics for you and it's economics for the consumer. And it doesn't always translate into just you've saved them money. If you think about Amazon and Amazon Prime, why do people love it? I need my kid has a birthday party tomorrow morning and I don't have a gift and it's 10 o'clock at night. I need it here first thing in the morning. So oftentimes the economics or the value that you're creating doesn't have to be dollars. It can be time, it can be access, it can be convenience. Right. And when you take those 3 things together, you know, companies like Apple, before Steve Jobs died, companies like Amazon have mastered that 3 elements of magnetism, the functional, the emotional, and the economic.
So much in that response. Oh my gosh, I think we could unpack it for another hour, but I don't want to take that much of your time.
Sure.
One thing that really resonates, I remember Sam saying this morning on main stage, Sam Glick, one of your partners, was that it's time for the health industry to stop building its economics around its own needs. You have to really focus on the consumer economics. So, so much touching on the point that you just made. Another question for you, Helen.
Sure.
Healthcare isn't exactly exciting or fun. Is it even possible to generate experiences that are going to make consumers happier?
Of course.
Okay.
It is possible.
Let's hear.
Just a few examples. So if you think about your hospital stay, right? My father had knee surgery. He's 83 years old. He had the knee replacement. The nurse practitioner called him the week before and said, Do you like to read in bed? What books do you want to bring with you? Do you have a reading pillow you want to bring, or do you want us to bring a pillow, to have a pillow in place for you? Do you have a playlist that you like to listen to? Now, my father is 83. He does not have an iPod. He doesn't have a CD player. He has 6-foot speakers. So that one didn't quite work for him. But it was very much like, what can we do to give you points of control in an otherwise negative experience?
How about that?
What can we do to allay anxieties and set expectations so you know what's going to happen? In one of the executive sessions this morning, we had a great dialogue with a gentleman from a children's hospital who said, how do I make people look forward to getting shots? Okay, you can't, no kid is going to look forward to getting shots, but you can build things around it. You can eliminate fear. You can put the parents at ease about what's the process going to be like, how is it going to happen. You can have an assortment of Band-Aids and say to the kids, do you want the Star Wars Band-Aid or the Disney Princess Band-Aid or the Minions Band-Aid, right? So you can build a lot of little pieces in that take their focus away from the negative and put it on other things that make that experience a more positive experience.
So Helen, I mean, you're referencing it's not always high tech, technology that's going to solve for it. You've had several speakers here at your summit talking about design thinking and really putting that empathetic position first, where if you think that way, everything else just kind of follows, doesn't it? So giving that patient control back in an otherwise kind of scary situation goes a long way.
That's right.
All right, so not always fun, but certainly human. So
you can make it better.
All right, well, Helen, thank you so much for your
My
time.
pleasure. Thanks for having me.
We loved having you here. We'll have you back again, I promise.
Okay, great.
Joining us here in the GuideWell Insights Lounge, my name is Kate Warnock. Thank you so much for watching. Good morning, everyone, and welcome back to the GuideWell Insights Lounge. We're here at the Oliver Wyman Health Innovation Summit. My name is Kate Warnock, and I have one of our very favorite guests joining us right now, Renee Finley. Renee, welcome to the interview.
Thank you, Kate. Glad to be here.
We're happy to have you. Renee is the Vice President of Innovation at GuideWell. So Renee, here we are at the summit, and the overarching theme has been the consumer imperative. In your role, I was wondering, what is GuideWell's strategic approach to innovation, and how has consumerism evolved that strategy since you've been in your role?
Absolutely. Thank you so much. So at GuideWell, our focus on innovation really begins with a laser sharp focus on the critical issues that need to be solved. So instead of trying to just focus on the latest, greatest technologies, we're really trying to understand and hone in on those critical problems. And in doing that, we put the patient or the consumer really at the center. And we anchor it around 7 core centers of excellence, if you will, that allow the consumer to be empowered. And those centers of excellence include everything from how we think about the whole being, right, the mind, body, and spirit of the individual. We think about the tools and resources, the digital technologies, the remote healthcare solutions that will help to give them ubiquitous access to healthcare. We think about the what we call consumer engagement pieces, which are the opportunities for us to connect with them through social, local, and mobile technologies. And then we also think about the role of data and how data can be so empowering, but it has to be actionable data and data that's relevant and in context. And so we really try to focus not just on the big data, but this hyper-personalized consumer information. So as we've made this journey, what we found is that the focus on consumerism really has to be driven around empathy, as we think about putting ourselves in the consumer's shoes. And we heard that a lot today in all of our Wyman sessions around the consumer imperative.
Absolutely. I mean, everything that you say, it just resonates so much with the speakers that we've had on. I hope that our viewers have been looking through all of our playlist. If you missed our speakers yesterday, Renee, we have them all available on demand on the GuideWell YouTube channel. But, everyone from Alexandra Drain talking about empathy, and Donata Temuto talking about how compassionate leaders like yourself are going to help the industry pivot to the consumer, which is where they always should have been, but for a host of reasons, as we know, hasn't always been the case. So wonderful that you're in your role. All right, our next question for you, Renee. As someone who actively monitors the trends in health innovation, what really has your attention as a trend worth watching?
Yeah, so there's really 2 or 3 key trends that I'm focused on right now. One is behavioral health, and it goes back to this concept of mind, body, and spirit, and how we put ourselves in the psyche of a consumer, understanding the emotions that they are feeling and what will actually resonate with them in terms of, as Kyra talked about, creating that stickiness for behavioral change. And so this whole focus on behavioral and mental health is really a key trend for us. Another one that I'm high on right now is Wellness Without Walls. So as we've been working with Johnson & Johnson and GE and Cisco on the intelligent home. The focus there has really been on bringing solutions in an ambient way to the home setting so that we are creating a greater continuity of care for our members and our residents. And then the third trend is really this idea around precision medicine. And I really believe that it's going to have a tremendous impact on how we think about healthcare going forward and the enlightened view that we'll have on how to get to a personalized solution, particularly in these cases of rare and undiagnosed disease. So it'll be an area of focus for me in 2017.
Very good. Well, Renee, I was hoping let's go back to the response that you just gave us about the intelligent home.
Yes.
Where is this? And,
Sure.
and tell us a little bit more about it.
Absolutely. So the Intelligent Home is located in Lake Nona Medical City, which is where our innovation center is located, just outside the Orlando airport. It's a triplex built in the Tavistock community. The idea here is that we want to be able to demonstrate products that are ready for market, but it also has products that are in test. And so we're able to capture consumer preferences, consumer likes and dislikes their way around the interactions with these different solutions. And then it also marries it with in the home setting, so it's not a laboratory, right? It really feels like someplace you could live. Not that you're in a test environment.
So does GuideWell have a particular area of focus for the intelligent home, or how are you supporting it?
We do, actually. So our focus, given the market in Florida, as we heard earlier in Dr. Lair's presentation around seniors, we focused on aging in place. And so we've got solutions there for monitoring movement ambiently in the home, so we're able to monitor activities for seniors. We're able to monitor through another platform called Remedy the diabetic status. And then we also have a new and emerging technology called KinderMed, and it's actually a sleep mask that emits blue light rays and will stimulate glands that prevent the secretion of melatonin. And as a result of that, we're able to prevent preterm birth. So it's a fascinating technology, and really excited about some of the new emerging solutions we're seeing in this space.
So I think that the thing that's wonderful about you and your role, Renee, is that it's not an academic conversation of where are we going. You are testing and continuously evaluating what makes sense for the consumer today. So even though you're looking 5 years down the road, maybe you're really looking at how do we go plan for these applications.
That's right.
So terrific. Okay, our last question for you.
Okay.
All right. So GuideWell just took a very collaborative approach in attempting to improve the cancer patient experience through its first ever immersion event. Tell us more about this model, and what will the focus be for the next immersion?
Sure, absolutely. So we were very grateful to have the partnership of American Cancer Society, Prime Therapeutics, Lilly Council, many others, Florida Hospital, Orlando Family Physicians, as we focused on the patient experience through survivorship. And it's both the patient experience and the family experience, as it turned out, through the conversation. So through this thought leadership model, we were able to dive deep to really uncover and peel back to more clearly define those critical issues surrounding survivorship. As a result of that, we've prioritized two key themes, if you will, that now will take to concept development. Those themes are around empathy, as we talked about earlier, and end-of-life care. So both of those will be progressing, and the way that'll happen is in this digital journey through both social divergence and then coming together in a convergent model to brainstorm around these concepts and actually build those solutions going forward.
Really smart conversations to have. So when you were talking earlier, you said that one of the trends that you're watching is behavioral health.
Yes.
And so I know that that's going to be a focus for your next immersion,
That's
isn't it?
right. That's right. So because, again, this concept of the consumer and their current psyche, and how do we put that at the center of what we're doing, our next immersion event will focus on behavioral health. It'll really tie into how does an individual present their best self, and it's both their best self, whether you're high performing or maybe you've been clinically diagnosed. Okay. We want to move away from the stigma around behavioral health issues and really peel that back in a way that allows for meaningful conversation and transparent conversation.
You know, and I know when you were referencing earlier, Renee, that you have these centers of excellence, that you look at these trends and you look at all of these, what's impacting the health industry, that you really are going to have such an interesting, dynamic conversation around behavioral health that maybe is very unique from other conferences. So,
yes,
I look forward to you leading that. And I know that for anyone who is interested, they can go to your website, which is GuideWellInnovation.com, pull up the information, and there's a contact form, and we invite everyone who's watching us to really take a look. And I know that you're soliciting, you're really highly curating the attendees, the speakers, and the participants. So it's a really unique environment. And I can tell you from the cancer experience that you just hosted, the chemistry that came out of that group, I think is second to none. So, kudos to you for creating that kind of environment, for that kind of collaboration.
Well, I think, if you create an environment where there's open transparency, it builds trust, and trust builds lasting relationships. And so we're pleased to have had that experience and look forward to the next one.
And again, it mirrors the themes that we've been talking through here at the Oliver Wyman Health Innovation Summit, how important empathy is, being real and transparent. And, as Donato Tramuto was saying, being willing to share maybe the things that have been real challenges in your own life, to bring out the best in others too.
That's right.
So,
good.
Well, Renee, it's always a delight to have you here at the GuideWell Insights Lounge, and I look forward to having you again at our next event. My name is Kate Warnock. Please keep watching.